I declare open this public hearing of the Joint Standing Committee on Aboriginal and Torres Strait Islander Affairs for the inquiry into racism, hate and violence toward Aboriginal and Torres Strait Islander people. I acknowledge the traditional custodians of the lands of which we meet today and pay our respects to First Nations people, their ancestors, their elders, past and present. I extend that respect to all Aboriginal and Torres Strait Islander peoples in their cultural and spiritual connections to Australia's lands and waters. In accordance with the Committee's resolution of 6 August 2025, this hearing will be broadcast on the Parliament's website and the proof and official transcripts of proceedings will be published on the inquiry website. Any answers to questions or notice taken at this public hearing will also be published on the Committee's website. I remind members of the media who may be present or listening online of the need to fairly and accurately report proceedings of the Committee. I now call on representatives from the Upper Nimpama. Excellent, thank you. Cape York Health Council and Wuchopran, is that right? Wuchopran Health Service to give evidence. For the Hansard record, would you please state your full names and the capacity in which you appear? We're starting down this end of the table.
Okay, thank you. Joy Savage, I'm the CEO of Wuchopran Health Service here in Cairns.
I'm Deborah Malthouse, I'm the CEO of Upper Nimpama Cape York Health Council.
I'm Thomas Hudson, I'm the Deputy Chair of Upper Nimpama Health Council.
Excellent, thank you very much. I've got a little spiel to read and then I'll invite you to make an opening statement. Although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as a contempt of Parliament. The evidence given today will be recorded by Hansard and attracts parliamentary privilege and, as I mentioned, is being broadcast live. You can see from the nameplates who is joining us today. Mr. Smith will be with us shortly. His plane was a little delayed landing. And I'm not sure if we have Mr. Venning joining us online just yet, so also the Deputy Chair will be joining us via teleconference throughout today as well. I'll now invite you to make an opening statement.
I might start, you right with that?
Mm-hmm.
Okay. So, Upper Nimpama Cape York Health Council is a community-controlled primary healthcare service delivering health and wellbeing across Cape York. Our board is made up of Cape York people, including Thomas, who's sitting with me today, and he's our deputy chairperson. They reside in Cape York, and they are a mix of elders and traditional owners within the communities that they live in across the Cape York. They bring to our organisation a wealth of knowledge, experience and understanding of the cultural protocols, the cultural issues and the health and wellbeing issues of Cape York people, so that we as an organisation can deliver services that are culturally appropriate and responsive to the need of community. As Aboriginal Islander people working in the health sector, we know that racial discrimination is linked to poor health and wellbeing outcomes. We know that social media abuse, verbal abuse, hate speech and unfair treatment based on race has increased over time. We see it every day online and in our own communities, and our personal knowledge is advised by and evidenced by data and research. Since the Voice to Parliament referendum, it seems that the racism has become normalised towards Aboriginal Islander people. The outcome of the Voice to Parliament appears to have given mainstream Australians permission to be overtly racist. Those who would otherwise stay hidden now have the courage to share their racist views openly and widely under the belief that their actions are unlikely to be challenged by wider society. In Cape York, challenging racist behaviours is even less likely for Aboriginal and Torres Strait Islander people who live in those remote communities, where services are limited and primarily delivered by mainstream organisations and government agencies, with little or no commitment to cultural safety or equity for Aboriginal and Torres Strait Islander people. Our board believes that there must be a whole-of-government approach to addressing racism and the impacts on health and wellbeing of Aboriginal and Torres Strait Islander people. The National Anti-Racism Framework that was developed by the Australian Human Rights Commission in 2024, we believe is key to improvements in this area. Implementing the 63 recommendations will demonstrate the government's commitment to ending racism for Aboriginal and Torres Strait Islander people, its principles of Aboriginal and Torres Strait Islander self-determination, cultural safety and intersectionality from a human rights-based approach provides a structured framework for us to work together to reduce, if not eliminate, racism against Aboriginal and Torres Strait people.
Thank you very much. Ms Savage.
Thank you, Chair and members of the committee, for the opportunity to appear today with my colleagues from the Penapema. Witchopperen has served the Aboriginal and Torres Strait Islander community of Cairns and North Queensland since 1979, when our community took control of health and wellbeing because mainstream services were not providing equitable care. Racism remains a daily reality for many Aboriginal and Torres Strait Islander people in Greater Cairns. Sometimes it's overt, more often though it's subtle, it's systemic, and it's embedded in policies, procedures and attitudes. We see it in the unequal treatment, in assumptions made before people are known, and in public commentary, in workplaces, schools, and particularly and more recently in online spaces. And racism is not only a social issue, it is a health issue. It affects whether people trust institutions, whether they seek care early, whether they feel safe and respected when they do. It contributes to poorer mental health, poorer well-being and poorer outcomes across the life course, and the evidence is clear about that. Access to diagnostic, medications and preventive care is a clear example. Costs still in a two-tiered system. People with money can access scans, medicines and newer therapies earlier, while many of our patients must wait until illness is advanced before the quality of that support is available. This entrenches disadvantage and is the opposite of prevention. There has been some progress. There are some health equity reforms here in Queensland, and they've been an important step forward because they do recognise institutional racism and require health services to work with Aboriginal and Torres Strait Islander communities and our services, community-controlled organisations. In our region, those reforms have strengthened partnerships, at least on paper, and have shifted somewhat the conversation from isolated incidents to systemic accountability. Legislation, however, alone cannot change culture. Recent events and online commentary in Cairns show how quickly grief and hardship can be met with racism, hate and stereotypes rather than a sense of humanity. That has real consequences for families, children and our communities. What is needed now, in our view, is a stronger accountability across public institutions, better measurement and reporting of racism and its impacts, sustained investment in Aboriginal and Torres Strait Islander leadership, workforce development and long-term support for community-controlled organisations that have built trust over decades. Most importantly, this must be a whole-of-community response. The responsibility to addressing racism cannot rest alone with Aboriginal and Torres Strait Islander people. The measure of success will be whether our people feel safe, respected, valued in their own communities, and whether our children grow up free from prejudice and hate. I thank you for the opportunity this morning and look forward to taking questions from the committee.
Thank you very much to both of you for those opening statements. We'll now proceed to questions and begin with Ms Cook.
Thank you, Chair. Sorry, I lost my voice for a moment there. Thank you for all coming today. In your experience, we are looking at the complaints mechanisms that people might access where they do experience racism. For North Queensland and the Cape, what's your experience of people trying to navigate those systems or seeking help where they have experienced racism within the health system? Can you share any insights into that for the committee?
You want to give an example?
Yes, I guess I can answer that because I live in the Cape. A lot of our people doesn't recognise it's there, the racism. But to people like myself and others, been through the difficult life and gone through it, that we can see it. And it's hidden in our community, but it's there, And the only way I picked it up is that through the service delivery, where where people come through the door, and attitude plays a lot of thing in this in the service too. If the attitude is not what the people expect, and then that turns them off. But that builds down to, for me, that the person in front of them has a background or has something in them of racism, and it's there. And I've experienced in our community this across the board in government service. There are always one or two racist attitude within the group, and I picked it up also by the service of people flying out and PDS and accommodation in Cairns. Accommodation in Cairns is quite terrible. There's one that is quite filthy, the rooms are, and we address it. And I've addressed that with Queensland Health. And these sort of things lead down to me, as long as they're black, we'll treat them the way we want to treat them. And I find that quite disturbing. But yes, it's there, and I address it through the channel, through Queensland Health CEO and my CEO to Queensland Health CEO in the right way. But sometimes it's addressed back to the ground, sometimes it's not. It's always there. Yeah.
Thank you. And in your experience, would you say that there are particular health issues or conditions that you've seen exacerbated because there's existed racism within the system? And can you share any information about what you've seen locally, if there are certain conditions that people haven't sought treatment for, or that the system hasn't accommodated them in a way, perhaps because of racism?
I think from a Cape York perspective, in terms of service delivery and accessing services when people have a chronic disease or a terminal illness, we know that there's a lot of, particularly our elderly people who won't leave home. They don't want to come because the service is in Cairns. The fear of coming to Cairns and then not being able to go back to country and passing away here, away from home, that stops particularly older people. It also might stop a younger person who is terminally ill, where they don't really understand the system and what's actually going to happen to them when they move away. Some communities in Cape York have a large number of people who have diseases like kidney disease that lead to dialysis. Dialysis services in the Cape are basically non-existent. So if you need to have a dialysis service, you need to come away from your community, leave your country, come to Cairns or to Atherton or some other place to actually have that service done. I think in terms of exasperation of conditions, we see a lot of social and emotional wellbeing issues leading to mental health conditions, because people might want a service or might actually go to Queensland Health or for a service or another mainstream provider for a service, but not actually understanding from the other point of view, from the service provider's point of view, about actually what's happening with that person and what's going on in their life, what's going on in their home, all the things that we know as Aboriginal people around the way that, the things that go on for us in our own environments, our commitment to kinship, our commitment to working with our own families and providing and caring for each other. A lot of non-Indigenous people don't understand that and don't recognise that as an impact. So someone who might come with a what might just seem like a low-level condition ends up being something more than that, because the service that they're getting or the response they're getting is not sufficient enough to keep them well and healthy, or responsive enough to actually keep them out of doing something that actually then causes harm to somebody else or to themselves. So if you think about in Cape York, and particularly in a couple of communities recently, in terms of the suicide of young people, or suicide in some communities have been quite prevalent in terms of it's happened to one family, so another family member it happens to, and then another family member. It's the understanding or the acknowledgement of the fact that that does impact because of what we see, and then our hopelessness of where we're going and what's going to happen to me. And if someone who I consider or respect as an Aboriginal person has done that, then what is there for me? Because that's what happens to them. So in one community in the Cape, there's been a significant number of suicides over the past several months. what happens is government then come together and say, well, we've got to respond to this and we've got to fix it up. Well, it's too late then. It's already happened. People are dead. So thinking about the early intervention, the prevention, the stuff that Joy talked about earlier, how we actually do that so that people are in a position where they not only get a service that they need, but they understand the system. Earlier you asked a question around the complaints process. Most people don't understand what that is. Most people don't know they can make a complaint. They'll come and get a service and think, well, that's it then. They'll either give me the service or they don't. There's no avenue to go anywhere and speak to anyone about what I need to do. We as an organisation across Cape York, we do advocate if we hear about it, but a lot of times we don't hear about it. So people, in my opening statement, I talked about the racism that happens in Cape York communities that has impacted on Aboriginal people by the service providers, mainstream service providers in particular, and Queensland government service providers, where people just put up with it because they think there's nothing that they can do about it. And part of it is because they don't understand the process, but also part of it is about, well, then where else do we go? If they leave the community and go out, then we get nothing. So we'll just take what we get. And that's the reality for some Aboriginal Islander communities across Cape York.
Thank you. Just one final question. You also run a child wellbeing service and youth and family services program. Can you talk about how racism shows up in some of those systems as well around children and families?
Yeah, so we don't specifically do as a program, but we do social emotional wellbeing services as part of the Family Responsibilities Commission that was developed under the Cape York Welfare Reform several years ago. So in our 4 communities that were deemed to be welfare reform communities, we have wellbeing centres where we actually work with families that are referred to us through the Family Responsibilities Commission or the police or child safety. I think, again, it's when people come to get referred for services, the majority of the time, certainly in the first little while, it's about, well, I have to do this. So they've told me I have to do it, otherwise there's a consequence to it. It takes a while for people to understand that it's not necessarily about the consequence of it. It's about how you help and support yourself and your family to get to a place where you're able to take care of yourself and look after yourself. Now, our organisation's vision is Cape York people are empowered to live healthy, happy lives. So that's our focus. How do we empower? How do we make sure that we as an organisation, who is a Cape York organisation, or that is a Cape York organisation, are doing things on the ground to support people to be in a position where they take their ownership and responsibility and care for themselves, with us being a support rather than the leader of or the doer of, whereas we're being led by them. So trying to, as an organisation, working out how we do those sort of things.
Thank you. Thanks, Chair.
Ms Cook. Mr G.
Yes, thank you, Chair, and thank you all for appearing before the committee today and for your evidence. Mr Hudson, you mentioned earlier that there were some issues with Queensland Health and accommodation in Cairns, and you said that you try to address this through the channels. Do you mind just elaborating on that issue which you raised and just giving us some more detail on what that is all about?
Well, I try to address it with Queensland Health because they're the one that handle the patient travel.
So what's the problem there with the accommodation?
The accommodation is terrible.
For who's the accommodation for?
For our patients that come from our communities.
Ah, right, okay. And where do they normally, where do they stay? What's the issue there?
Well, they stay where Queensland Health allocated.
Right.
They don't have choices.
Right.
They have just a list of accommodation where people are put in, and that's it.
Okay, so they're coming in from remote areas.
Yes.
And they're being put up in accommodation which is not up to standard.
Inappropriate.
It's inappropriate. Okay. And what's the response been from the Queensland government when you raised these issues?
Well, I went through the channel. I didn't get no response on it.
Okay.
Yeah.
And is this still an ongoing issue?
I think it is.
Yeah.
Because I also experienced it with my family.
Yeah.
I go and dress it myself.
Yeah.
I go inside and I talk to the manager and I tell him straight as I see it.
Yeah.
And I think that's the only way you can do it. Just shoot it as is.
Yeah.
Because we live it, and I'm the type of person that I shoot the way we live and what we face with.
Yeah.
Not
All right.
beating around the bush.
Yeah. All right. Thank you very much for that.
Thank you, Mr G. Senator Thorpe.
Thank you, Chair.
Inflicting bodily and mental harm to a group of people is genocide. They steal our children, they lock our people up, have high suicide rates, they cause mental harm, the colony, the services, the government. Would you agree that governments inflict such harm on our people that meet the definition of genocide in this country?
Exactly. Could I answer that? Exactly. One of the things that I find, and exactly what you outlined, is that taking kids off mothers' arms, and they say that they are going into a better welfare and be looked after. I say no to that. A lot of our kids went out and got raped and got hanged. I just lost my niece's child this last year, hanged himself in a carer's situation. So nothing. I think they put in more harm than what they are. You just got to understand that in Aboriginal culture and society that we have a lot of extended families, even though we're not blood connected. And then we, as long as we're from the one community, we share kids, we share this, we share that, and we can have those responsibility passes on to our extended families. And instead of going out to the unknown world where they get raped and they get traumatized till the time they hang themselves. The other thing, the pressure the government that put us, that raises all these things, is the AMP that put to us to tell us what to drink and how to drink it, and whatever. Where no other community in Queensland has that. They do limit the pubs around here for the wild things that are happening, but our community, to a sense, is not as wild as that here, and I don't know why we're going to be treated different.
Thank you.
I'll go next. So yes, Senator, I agree completely with what you're saying. I think I don't live in the Cape. I'm an Aboriginal woman. I grew up on an Aboriginal reserve, and my family is Aboriginal. I've been Aboriginal all my life. I've not been anything else. I have lived in the Cape. I don't live there anymore, and I have family in the Cape. But I think when you think about, I've been in Aboriginal Torres Strait health for nearly 50 years, so I've been around for a long time in terms of seeing the things that happen. And I was around when the ATSIA first were established in the early days, in the late 70s, and certainly with Chopin in the early 80s. So I can see over those many years how we have, when you think about colonisation and the disadvantage and all the things that impact on us as Aboriginal Torres Strait people, and what we know about, and the fact that non-Indigenous people in this country still don't recognise or understand what that looks like or what that means for us. And you hear sometimes, get over it, it happened in the past. It might have happened in the past for you, as a not you, but as a non-Indigenous person, but certainly not for us, because we carry intergenerational trauma. We hear about it. I grew up with a grandmother who was taken away when she was 9 years old to go and live on work on a station. So those things are in my lifetime. I'm 68, but they're still in my lifetime. And there's stories that my children hear and they hear about, and they know because they need to know their history. They need to know where they came from. So just thinking about what that looks like for them, even though their lives are a lot different now and they're in their late 30s and 40s than what mine was like. Until wider Australia understands that our history needs to be understood by them and not just by us, and we talk about the truth-telling and what that looks like. At the end of the day, when I went to school a long, long time ago, we didn't learn about Aboriginal history. We just learned about the fact that Captain Cook came here and found Australia, and aren't you all aren't you all happy that we're all here now? I think it's really important to think about the changes that need to happen of Aboriginal and Torres Strait Islander people need to be understood by non-Indigenous people in terms of them thinking about the things that Joy talked about, systemic change. What does a system look like? How does a system change? But people need to understand our history, our real history, not the one that somebody made up and wrote in a book to tell us about what happened when Captain Cook came here and made us all British citizens or whatever we were all those years ago. And I align to what you're saying in terms of it is a form of genocide, because we as Aboriginal Torres Strait Islander people are seeing our people and our families. I mean, I go to funerals at least 2 or 3 times a month. you know, and they're not even my close relatives. So our people are dying, and they're dying at a rate that is higher, I think, than what it was. And sometimes I think maybe it's because of my age. You know, as I get older, people around me die because they're my age. But in terms of understanding history and understanding what happened to Aboriginal and Torres Strait Islander people, it's really, really important. And it's important for people to understand, mainstream Australia to understand it. That is, until we understand that, until we recognise that actually happened and it's not made up stories, the healing won't happen. It'll just keep going on for generations and generations.
The ongoing impact of colonisation is just profound. If you think about, you know, the systems of governments, they are colonial constructs. So its origins, its history is the kind of kernel of we're trying to make these institutions work for us, but the genesis of them lie in a colonial construct. So that means that it's ongoing, and we all do our very best to try and protect against it. Early deaths, not receiving services when people should receive their services. There is ongoing harm, despite individuals' best efforts at times to see a different kind of world. And in really practical terms, we see it in health in simple things that I hear about, like 3 strikes and you're out. Now, if you come from the Cape and you are in Cairns for specialist appointments, but the letter notifying you of your specialist appointment has gone to a post office in the Cape, care of post office, and you don't get it, you don't know you've got an appointment. Secondly, they might ring your phone, there's no identification, so it could be anyone, so many of us, we screen those calls. So if you haven't responded to that one and then you get a third notice and you still don't respond, you're then taken off that wait list and you have to start the whole process again. Now, if you understand the environment in which people live as a system of care, you would work very hard to adjust that. You'd either work with the ATSIAs, which our systems do, but it's imperfect. So I think, you know, that's just one very practical example. Talk in health about the kind of ambulance, you know, at the bottom of the cliff. You have to almost get too sick to be able to get the services that you need, whereas many things could be done in a much more preventative way. Access to medicines, not when you've got diabetes, before you got diabetes, perhaps to lose weight so you don't develop diabetes. You know, there are many examples, small and larger, that speak to a system that's still trying to grapple with its own history and reality, and despite its best efforts, still denies and causes harm to people.
Thank you. I was born into community control in 1973 at the first Aboriginal Health Service in Victoria, so I know how much our Aboriginal health services struggle for resources, and know, you know, just trying to cope with the amount of people coming through the door. You're not funded to deal with racism. You're funded the very bare minimum just to keep the doors open. So what can the federal government do, given we're all federal here, to alleviate some of that burden that your services and your people have to endure every minute of every day? People are coming sick to you because of what's going on with the systems and the cops. We know the cops are racist here. We heard that yesterday in Brisbane. Queensland cops are out of control. They've got a licence to kill our people. So what can the federal government, what do you want the federal government to do to alleviate some of that pain that you are experiencing in your services and our people? Because we heard yesterday also from Nacho that we have a really great health minister who's really wonderful and doing wonderful things and patting him on the back. So what would you say to the health minister to alleviate some of that burden you carry?
One of the things I would say is that we walked out of Community Service Act, and I've been through all of this as a member and as a leader, and then we walked into the Local Government Act. So when we walked into the Local Government Act, we were told we'd be treated like every other shire in this Queensland or in this country. Well, I can tell you we're not. So what I'm asking is that why don't treat us like everyone else? And the service be the same service as Cairns and wherever. I'm saying that because I've lost two nephews that went to the hospital for a chest pain, and went in there, and they stuck the thing in his arm and put some fluid or something in him. They then say, you can go home, and they walked around with that. One of them walked around with that, and I said, what are you doing with that? You should be in the hospital. He said, no, they told me to come, and if I get it, I can race back, they can stay. I said, they should send you to Cairns. That afternoon or that evening, he dropped dead at the back of his house. The other one didn't wake up the next morning. Now that shocked the whole community. And to me, what they couldn't do in that hospital, they should have put him on the RFDS straight to Cairns. And that's one of the thing that we see, that we're not treated. If it happens in Innisfail, they'd be straight into Cairns Hospital or Townsville. So what's happened on this shore here should be happening on our shore the same way. We should be treated the same as the mainstream. Because that's the thing that they said for us to walk into Local Government Act. So I think we're still different, we're treated different. So that's all I ask the government, the feds, if they could treat us the same as like every other service runs out everywhere else. Don't treat us different because we're in an Aboriginal community.
Thank you.
I think in terms of what Thomas is saying as well, is when you think about, and I do know that we're talking about federal government, but in Cape York, there is also the Queensland government with Queensland Health Services. So in Cape York, for example, they try to do everything. They want to be primary healthcare providers. They want to be acute care. They want to be emergency. Pick a lane and stay in it, and let us do the primary healthcare services. We need and I think the government needs to recognise that primary healthcare services delivered in a remote community is not the same as delivering. I've been the CEO of Witchoppin as well in the past, so delivering in an urban centre and then delivering in a remote community. We have 11 communities that we provide services to. So that's, there may not be as many people living across the Cape, Aboriginal people living across the Cape as there are in Cairns, in the immediate Cairns region, but it's really hard to try and deliver services to 11 discrete individual communities who have different, maybe general needs are the same, but specifically different needs around, depending on culture and protocols and how they want things run in their community or delivered in their community. And then we as an organisation have to fight with Queensland Health about who's doing it. Torres and Cape doing it, or we doing it. They just need to stay in their lane. And their lane is emergency and acute care, and that's where they need to stay. And let the ATSIA sector do the primary health care, do the early intervention prevention, and all the things that we were set up to do in the first place. And we do better probably in urban situations than we do in the Cape. When I came to work at Upper Nipperma, and I've been there for 6 years, I was gobsmacked, I suppose is the word, about the difference of the relationship that you have when you're working in an ATSIA in an urban centre than when you are in a remote community, and how much authority and power and that Queensland Health takes away from. We're a community-controlled organisation. Our bosses are people like Thomas. They own this organisation. So there's a whole different dynamic about the way we work and how we see ourselves and how we view ourselves as organisations. owned by community, delivered by community, which is completely different to how a government service operates. So I think that's probably a message that I want for you to take back is, yes, I know we're talking about federal, but there is also, in Cape York in particular, there's also another big player that can be obstructive and try to push us away when they should be engaging with us and bringing us forward into and allowing us to do our job.
Sorry, can I just ask as a follow-up? Has it got worse since this new racist government's been in, or are they just all the same?
I can't. I see it pretty much the same. I think for me, what I see is out of sight, out of mind. You know, because they're in terms of Cape York, and I have a good relationship personally with the CEO of Torres and Cape. We talk all the time, but at the end of the day, he's not on the ground. It's the dons and it's the workers on the ground. They get to do whatever they want, whenever they want, with no oversight, from my perspective. And that's where the problems lie when we're trying to do things on the ground. Even in just recently, about 2 weeks ago, I had a feedback from one of our centres up in the Cape where they asked me to look into why one of our clients, because we don't do after hours care because we're not acute service or an emergency care service, so someone wanted to go and get a service from the TCHHS centre, Primary Healthcare Centre, because that's what they call themselves, to get care. And the question was, are you an Apuna client? I'm an Apuna client. If you are, then you need to wait and go and see them. And who does that? Yeah. You know, at the end of the day, they have a remit as a government body and a government organisation to deliver services to people outside of hours, because that's what they do. So having that constant battle about which client are you? Well, you're a member of that community. You're entitled to get that service. You can't say go away if you're an Apuna client. You can't go down to Cairns Base Hospital and they ask you, are you a Wheelchopper client? If you are, you need to go back and wait for Wheelchopper to open. That's the sort of stuff that is probably happening a lot more in Cape that I see. I don't know about you, but that's what I see. Yeah.
Do they ask white people that?
I have no idea.
I wouldn't mind having a crack at if I was asked or speaking to the Federal Health Minister. I think I'd start with, I think we can actually be bolder and more courageous around Aboriginal and Torres Strait Islander health and the central role that Aboriginal Community Control Health Services have played for more than 50 years now. I'm a Deborah Malthouse protege. Worked for her when I was in my early 20s, and have grown up in community control services, 40 years association with Wheelchopper, and it's great to be back home in my home community to have the privilege of serving as the CEO again. But I would say that we've got to stop the program confetti that is distributed and get back to core comprehensive primary healthcare funding that meets the needs of our local communities. Now, whether that can be done through a special kind of, dare I say, black card akin to a vet card or something else that provides our communities who have some of the most complex and carry highest burden of ill health can access the best specialist care. And I say that not because good services aren't being delivered, they are. And we work within the system and make the system work for our communities. But there in fact could be other ways to do it as well.
That idea come from an Aboriginal man in South Australia who was blind, and he said, we need a gold card like the veterans do, and we need our people to be able to access the best care. And I've always kept that in my mind, and to hear that again, maybe 25 years later, we still need that black and gold card. But thank you. I could talk all day. I better pass it on.
Mr. Smith.
Thank you. I guess I'd like to unpack a little bit more the relationship between the ATSIA and Queensland Health. Joy, you'd remember the battles we had, particularly around community care and having different medical record systems, Cohen being a prime example with RFDS on one system, Queensland Health on another, PMP on another, and then, given the transit nature of some of the populations moving from community to community for cultural and family reasons, losing patients along the way. And to be honest, what I saw during my time was the removal of community input into the way health was given to each community. And I think that goes back to the gutting of the health workforce some 15 or 20 years ago. What do you need from Queensland Health? Because they are the big player, as you put out, that would help. And I'd also like to look at some of the decisions they've made, including around medical record services and the removal of forensic pathology from Cairns and how that's impacting the communities.
I think that's more
I remember River, which is what we call River. I think it was the first year when I started at Marin in 2020 when they were bringing this new River system in for the sole purpose of having one shared record system. My issue with it, and it's still my issue when people talk about sharing records, is people have the right to say no. And why is that at that time, as well, I've said to the then CEO of Torres and Cape then, why is it that there's an expectation that all Aboriginal and Torres Strait people that live in Cape York are okay with everybody having access to their records? There's a privacy legislation that we need to all abide by, and someone saying that, okay, we need to have access to records so that when they move around, when people go to places, wherever they happen to be, we can see the record. I get that, but that's called My Health Record. And if people use My Health Record properly, then that's where you'd be able to find that information, rather than having one shared system that all the Queensland Health on the Torres and Cape and ourselves and RFDS were going with. The plan was to do that. We didn't buy into that, because at the end of the day, as an Aboriginal person living in Cape York, you have the right to say, no, I don't want Queensland Health or RFDS having access to my records. So even that whole idea about taking away people's rights to actually say no by putting in something that makes life better for whoever, I don't know, is problematic. You don't do that in Cairns. The Wutroppin has their own records. Queensland Health have their own records. There's never been any thought that, well, let's all have one shared record because we'll make it better for you because you happen to be moving around. We move around down here too, so there's no different. I felt that at the time I thought that was really a racist thing to do, under the guise of we're going to make your health better because then we can all see what's going on with your health. In terms of the forensic, what you mentioned of going, I'm not sure what the impact of that is. I haven't had any feedback around that. But I think in terms of the relationship with Torres and Cape, and I said this earlier, at the high level, because we have regular meetings with our executive and theirs, we do them every 2 months. I talk to Rex all the time. We do that stuff. It's on the ground that's the problem. It's how the local directors of nursing who run their own clinics operate. And they tend to operate based on what they want and how they want to run it, rather than this is a standardised process for Torres and Cape. This is how we do all our business in community, and this is what we do as a government agency. It depends on what they want and how they actually want to do that. And that sometimes those relationships can be really good, and sometimes they can be crap, and it doesn't work. And community people don't get a good service. I've lost the rest of your question.
That's right. In your experience, what makes the relationships really good between community and the Dons?
It's working together.
Yep.
Because what Deb just said is true. Because you find across the board with Aboriginal service in our community, the police, the education, and the Queensland Health, the principal comes in and run it her way, no other way. The sergeant does the same, and so does the Don. It's not them. What we want them to come in with the experience and work in the best interest of that community, best interest of that client and the community. And the way they do that is also understand and recognize our Aboriginal culture. And none of those organizations do a cultural induction. We've been asking that for years. And if they do run one down here, Aboriginal culture induction. That's completely wrong in any Aboriginal sense, because in Aboriginal culture deep down, no one can speak for another person's country. So you got to do it on ground with our elders, and it has to be done properly. And recognition is one of the words that people don't recognize at times to make things happen easily for them on ground. They think they know all, and that's just it. They know all in their expertise as doctors, nurses, and that's what we need them there for. But they don't know the other parts of the community to meet and to make their service met our community by going through those cultural components and also the behavior of our people. And the biggest thing of our behavior of our people that rises all these races and whatever is the things are on us. And that's one of it. I say this till the cows come home. It is the AMP. It has to change. It's just getting worse.
When new dons, new teachers, and I look the transient nature of some of the workforce, that the FIFO model particularly, which is used, is obviously causing a lot of harm in terms of people aren't developing that connection with community, along with the giant fences that are now out the front of all the Queensland government buildings. Do you feel like there is a them and us feel between the state government employees and the communities they're there to serve?
Yeah, I do. It's not about them and us, it's about we. We're all in it together. And to address something in our community, I said this when I was the mayor, to address something in our community, we all have to address it, all of us. Don't say, no, it's the community's fault, no, it's the education, no, it's the police got to get it. No, it's all of us.
Thank you.
So we also have the issue with the workforce and transient workforce, particularly around doctors and nurses. So we use a lot of locums, and we have the same issue with them understanding what the realities are for Cape York people. We try to do some work with them from a cultural perspective so they understand, and then we have our local health action teams in community, of which our Deputy Mayor is a health action team chairperson in his community of Konyama. And part of that is about our staff doing some work with them when they come into community to actually understand what it's like to work here and what we expect of you when you're working in the organisation. But for those professions like doctors and nurses, we have the same issue. Transient, they come for 6 weeks and then they go. They might come back in a couple of months' time for 6 weeks. The relationships don't work because they're not there long enough to develop, and they're in and out. And that's been a problem for us for certainly the last 3 or 4 years.
The Torres model of care, which has been brought up multiple times over the last few years, is essentially a community-led, health worker-led scope of practice where first contact is with health workers and then they lead the patient through whatever clinical decisions and discussions need to go forward. Is that something that would be beneficial to the Cape and the Torres Strait in terms of better health outcomes?
Yeah, we use the same model.
Yeah.
We're Aboriginal-led, and all our shows are, as far as I'm aware,
Yep.
Aboriginal-led in terms of our health workers and our health practitioners. I think it's important, and most of them, where we can, we have local people in those jobs. It's often not a possibility, but if we do bring non-Aboriginal people from outside of community, they are also encouraged to be the same people all the time. So we have, because we have a lot of FIFO, we have a large FIFO workforce because of the accommodation or lack of accommodation in the community. But I think it's around people understanding and accepting, and this is our model of care. Our model of care is Aboriginal and Torres Strait Islander-led health worker or health practitioner, and supporting the clients and giving advice and guidance to the non-Indigenous staff about what the realities are and how they can work with people, whether it be an old auntie or uncle, or what are the cultural issues, and how do you make sure that you take into account those issues that happen in that community, because not all the communities across Cape York, that they're not the same. I mean, there's some are more traditional than others, and some have additional things that are you required to do. And you can't just think that because I've gone to Konyama, I can go and work in Arakuna, or I can go and work in Mapu now. You have to have that initial understanding about what's the realities for working with people from that community.
Just to touch on workforce, are you getting enough male health workers through the system?
Absolutely not.
obviously a very female-dominated kind of area. We're starting to see more men take up and be interested in traineeships, but it's at a very slow pace. So there's a lot more work to do with schools and with other sort of training bodies to stimulate the kind of interest from male school leavers and young men to take up careers in health. Certainly seeing more men in the sort of child, youth and families sort of space and youth kind of programs, but in primary health care it's still one of those things that we're working on. I think it might be helpful just to paint the picture. You've got Apinipima and Wichoprin here, but we are 2 of 9 Aboriginal community-controlled health and health-related organisations that are spread through far north Queensland. Wichoprin was the first to be established. We often struggle in our own right, and that's why we firmly believe in local community control, but we build up from there. And we have a regional body as well, and so we've got 7 other sort of peer sister organisations. And if you think about this region, Cairns or Gimoy might be the hub, but you know there are 50,000 Aboriginal and Torres Strait people in this region, 24,000 in the Cairns greater region, 2.5, which is probably underestimate in Yarrabah, some 50 odd kilometres just down the road. And there's how many in Cape?
Around about 5
Around 5.
We just do the lower Cape, we don't do the
Yeah.
northern peninsula area. So probably around about 5.5, but maybe 6 in the area that we cover.
Combined, we employ over 1,000 people in our services. You can ask yourself the question why we have on average a 70% Aboriginal and Torres Strait employment. How does that compare in other health providers where population is concentrated with Aboriginal and Torres Strait people? It is a stark contrast and almost affirms our point about the power and the benefit of local community control. And the kind of the relationship, whilst we have formal agreements, which is fantastic because we can use them as a in our arguments when things don't work on the ground, that very real issue that Thomas has shared on the ground is what the communities battle with every day. I mean, we have a far north Queensland regional health partnership where all the CEOs of all the leading health organisations have signed up to a statement of commitment to work towards health equity and to rid the health system of institutional racism. So it is open, it's an honest, it's a robust relationship. But even with those sorts of things, as it moves down the chain and gets on the ground, there are still real issues about the access and the quality of that care and the compassion and humanity in which that care is transacted.
Just one more, if I may, slightly sideways topic. The census is coming up in August. As you rightly pointed out, there might be 2,500 people in Yarrabah. I would believe there's probably closer to 3,500, and that's replicated right across community, right across the Cape. There is an inherent distrust of the census for a variety of very, very, very good reasons. My belief is that the health services probably have a better understanding of how many people are in community at any given time. Is it something that would be possible or you would be interested in providing the data on the numbers? Because so much of the funding models are tied to population bases, and if we're stuck, with a document that says there's 2,500 people, and okay, so there's 2,500 people worth of investment going into that community, and there's 3,500 people, well, that shortfall is going to exist and never ever actually be rectified. Is that something that the health services could do if ABS or census or whoever were interested in getting real data?
I think there's a
at least.
I think there's a difference between how you'd know those numbers in a remote community than in an urban setting like here, where we are one of we are the only community control health service that's been kind of going for 47 years delivering primary health care, and we know this community pretty well, but its population has exploded in the last little while, and it's growing at a fast rate, and there's many other primary, well, I wouldn't say primary care, but GP services. Comprehensive primary health care, I would argue, is different, particularly when delivered through a community control model. But certainly we have in the past assisted ABS and tried to have conversations with our community, because we know that it's that data that drives planning and resource allocation and so on. But, you know, history is history and mistrust is mistrust, and it takes a long time for that to change. And if there's one misstep, after people kind of go, okay, well, I will trust. If there's a misstep, then you're kind of back to ground zero. So, but in short, yes, we often do assist the ABS with surveyors and so on. Yeah.
Can I just ask a follow-up
Question just on given ABS is another colonial structure, and they always want our data, they want our blood, they want our brains. Nothing's changed. They want a piece of us. They're always studying us so that they can destroy us, basically. Is there a way that, because of the mistrust, and rightly so, that the ABS should respect our ways, our law, and trust in community control services that say we have this number of people, or we need this much funding to cover these many communities, rather than justifying ourselves to another colonial structure? Like, should government think differently in how they operate, like decolonise the government, if we can do that, and work the way that works for our people rather than what works for the ABS? I'm not taking away what you said, brother, but it obviously, you know, I don't trust the ABS. I'd rather sleep somewhere else that night myself. So is there a way that the ABS can do better, our way?
Yeah, I sort of can't take that, what you just said, that you're not getting it right. Because I lived in Kanyama for nearly over 40-something years, and our numbers in our population, it was 1,200 for about nearly 5-10 years. And I said, God, we got babies born, we got people that are dying, but we got babies born just about every day. So surely the crisis changed. And then they go and put it back to the community. Hang on, you got people running around the Cape too. We just had a couple stay in my accommodation just the other day. If they can't get it right, and they're splashing all these people across Cape to count people, well, there's something wrong.
I mean, it's a survey, it's a national survey. I think one of the ways institutions can work with communities, though, say, well, this is what the survey said, but what do you tell us? And how do we bring that as an interpretive piece, so there's actually more information that, you know, they can do their thing, but also respect the knowledge, understanding, and even our own data in our services around how that moderates what is a national survey that may well be an underrepresentation of certainly the numbers that drive funding and resource allocation.
Thank you.
Because if the system doesn't, that system doesn't change, they're always going to be undercounting.
Yeah.
Because people aren't going to complete the survey. The other reason that people don't complete the survey is partly because of what you said around what are they doing with my information, my data, because there's mistrust there, but also people not understanding that they use that, government uses that data to be able to provide funding for services. So that lack of understanding is, you know, is also there. People just don't fill them out because they can't see the value in it.
Thank you, Senator Thorpe. I've just got one follow-up question from something you said earlier, Ms. Malthouse. You didn't necessarily say it in these words, but essentially you were pointing to truth-telling as being a part of that preventative health work. Do you see truth telling as a part of what it is that governments around the country should be doing to support the health and wellbeing of First Nations people?
Yeah, I think that not wider Australia do not understand or know the history of this country. They don't know what happened to Aboriginal Torres Strait people when when we were colonised, and all the things that have happened to Aboriginal Torres Strait people over the years. You've got Cape York communities where people who have been, there may be some traditional owners there, but there's also historical people because somebody moved them. Government decided to take those people from some other place and plonk them there, and then say, well, they just stop there then because that's how we can look after you. They didn't just, that whole idea about what happened to Aboriginal people over the years, how we, not just what was done through colonisation in terms of all the massacres and the bad stuff, but also what we as Aboriginal people have brought to Australia over the years, because there's good stuff that we have done that nobody recognises, or very few people, that's probably not the right thing to say, very few people recognise that or understand what that is. I think when you look at some of the work that needs to happen through the truth telling, is people need to understand the realities from a historical point of view. They need to understand what intergenerational trauma is, and need to understand that even as Aboriginal Torres Strait people, we're still traumatised by things that happened in the past. We carry it with us. It's just something that actually exists. And that lack of understanding impacts then on how they deliver a service, what service we get, and how they use that information or don't use that information, because the service that they deliver to us is more around the Western model, this is from a health point of view, the Western medical model. There's no thought about what we as Aboriginal people think or see or hear or feel throughout our lives. I mean, I know I did mention this, my life has been completely different, or I shouldn't say completely, but it's completely different than my own children because of how I grew up. And I imagine with Joy and Thomas living in a remote community all of his life. We all don't come from the same place. We all have that understanding, but we know our history. And we make, if we don't know, we make an effort to find out about it. Non-Indigenous Australia don't. They just say, we came here, we landed on this country, look at all the things that you have now because of us, and not thinking or understanding that we've got a voice too, and someone should be listening to what our voice is and hearing what we're saying and understanding that.
Yeah. And it sounds
Just
like...
to add on to that,
Yeah, absolutely.
It's quite difficult for a half-caste, which my family went through. My grandfather was amongst the stolen generation that took from Vanrook to Marpool, where I was born. The half-caste lived a very difficult life within their community with the full-bloods, and it's not the case of case of themselves. It's a movement of government in those days, moving people by chain and all sorts of things, and picking up all the half-caste kids out of their tribes. And the stories that have been told where half-caste kids had to bury themselves in sand or inside a log, just hiding themselves from police coming along to pick them up, that sticks a lot in families, because that's a terrible thing to grow up like that. And my grandmother went through that, and she lived to be 104 in Konyam, and she's the longest one then. She died now. But those sort of things, exactly what Deb's saying, is still within people, and the traumatized is the stick where we've been treated as half-caste before, but then when we try to mix and mingle with our black culture, black people, we again have to go in the door and we treat it different. We treat it different because we're not full-blood, we're half-caste. So but now it's starting to surface that we're all at one. But through the ages of me growing up and my family going through it, it's very, very bad life. But we went through it and we made us stronger. But we had to go through all that with all the fault of not ours. It was the fault of government.
Exclusion and that real question about where you belong on both sides.
We're still picking up the pieces of my grandfather's history and my mother's history from Cohen in the gold rush time. She's from around Cohen. We don't know who her father is. Is it the Chinaman that cooks for him or what? See, that's how bad it gets.
And we can all see how those things would lead to an inherent mistrust in services and government. But there's not that same appreciation sometimes from service providers or from governments in terms of appreciating why people might not trust you on face value in the same way that other Australians or other Queenslanders might, when that's your history.
Yeah.
And that's what's being
Because
told,
most
that's
of
been
us are
handed down to
educated,
you.
probably more educated than the locals, and we speak up for ourselves. So that's a difference there too. But we speak up for ourselves, for our fourth brothers and that and sisters within the community. We don't leave them behind. We want. So, such as me, I speak up for Konyam in many cases, and in front of the health or the police or the school.
Yeah. Certainly stronger together, and we've got to stand up for people who don't have that same voice and platforms. But thank you very much. We have gone a little bit over time, so I appreciate you hanging with us this morning, and the evidence you provided to the committee has been really valuable. So thank you very much. I don't think you've taken any questions on notice, but if you have, or if there's any additional information that you want to provide to the committee after today, where you think you walk away and you think, I wish I had have said that in response to that question, or you think there's something else that the committee should know about your context in particular that's going to help with this inquiry, if you can please forward that to the Secretariat by the 19th of August. 18th was yesterday's date. 19th of August. And you'll also be sent a transcript from today and have an opportunity to, if you, when reading through it, you see any errors that are there, you can request corrections to any errors that you find. So thank you.
I do have a number of questions on
there you
notice,
go.
particularly around climate change and emergency evacuations and the racisms around that.
Excellent. There you go. You will get some questions on notice from the committee. So thank you very much. I might just take a quick 1 minute suspension to allow our witnesses at the table to depart while we welcome our next people who are online. All right. We good to go? Excellent. I now call on representatives from the Royal Australian College of General Practitioners, the RACGP, to give evidence. For the Hansard record, would you please state your full name and the capacity in which you appear before the committee?
So I'm Dr. Karen Beverley-Nichols. I'm here as the Chair of the Aboriginal and Torres Strait Islander Health Council at the RACGP.
Thank you, Dr. Nichols.
Good morning, Chair and Committee. My name is Kate Freeman. I am the Senior Policy Advisor with the Faculty of Aboriginal and Torres Strait Islander Health at the RACGP.
Excellent. Thank you very much. I've got a short spiel and then I'll let you know who's in the room with us. So, although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as a contempt of Parliament. The evidence given today will be recorded by Hansard and attracts parliamentary privilege and is being broadcast live on the Parliament's website. Joining me in the room today is Mr G, Ms Cook, Mr Smith, Senator Thorpe and myself as your Chair, Senator Stewart. I will now invite you to make an opening statement, please.
Thank you. Good morning, Chair and committee members. I'd just like to acknowledge that I'm dialing in from a Awabakal country and pay my respects to the elders past, present and emerging, and acknowledge the ongoing resilience and strength of individuals and communities. As a Torres Strait Islander woman and GP, I'm here to add my voice to the chorus of Aboriginal and Torres Strait Islander people who have already provided substantial evidence and recommendations to the committee on the prevalence of racism and on the solutions that lay before us. GPs know what supports health and wellbeing, and the RACGP knows that while race is entirely a social construct, racism has direct, devastating biological consequences. The fourth edition of the NACCHO RACGP National Guide to Preventive Health for Aboriginal and Torres Strait Islander people is a robust and evidence-based clinical guideline. Its topic on the health impacts of racism adds to medical evidence what Aboriginal and Torres Strait Islander people have known for a long time. There is a clear link between experiences of racism and poorer health outcomes, including, just some examples, high blood pressure, heart disease and psychological distress. To support patients to deal with the health impacts of racism, GPs need time to care, to build trust, establish rapport and to provide trauma-informed care. The current rebates for long consultations do not facilitate this. Aboriginal community-controlled health organisations do incredible work and are exemplars of culturally safe, holistic care. We call for their support. We support their call for increased funding to meet community need. We must also ensure that mainstream healthcare settings, including hospitals, are culturally safe and free from racism. We must ensure this for our patients and for Aboriginal and Torres Strait Islander healthcare professionals. Our medical workforce faces structural and systemic barriers. Data from the National Medical Training Survey shows that more than half of Aboriginal and Torres Strait Islander medical trainees have experienced or witnessed racism in their workplace, nearly double the national average. Consequently, 1 in 6 of these trainees reports considering leaving the medical profession within the next 12 months, directly citing culturally unsafe mainstream environments as the primary driver. There are things at work. Our faculty has a Yagala Wadamba program, a culturally safe exam support program for Aboriginal and Torres Strait Islander GP trainees. The Australian Indigenous Doctors Association and the Indigenous General Practice Trainee Network also do vital work to support Aboriginal and Torres Strait Islander clinicians. The RACGP will celebrate 200 Aboriginal and Torres Strait Islander fellows in the next 12 months. We are so pleased about this. It is a testament to the effectiveness of programs such as those I've just mentioned. but we must ensure our fellows can thrive in their workplaces, and racism is currently a barrier to this. Our submission contains recommendations and 3 things that we would ask the federal government to prioritise include: 1, adopt the Australian Human Rights Commission's National Anti-Racism Framework. 2, enforce systemic accountability in the mainstream healthcare sector, establishing safe, confidential reporting pathways for racism, and support activities for measuring, monitoring, and eliminating racism in general practice and the broader mainstream health system. And 3, support GPs with time to care by increasing Medicare rebates for long consultations. Thank you. I'm really sorry, but there's an echo. I'm hearing my voice echoing back, which is a little bit distracting.
No, thank you for letting us know. We aren't getting an echo on this end, so just let us know if it continues to happen broadcasting or work on it as we're chatting to you. Before we go to questions, I just heard somebody join us online, so I'm just wanting to check who we've got with us.
Hi, Madam Chair. It's Jamie Chaffey, Federal Member for Parks Online.
Thank you, Mr. Chaffey. Appreciate it. Okay, so we'll now proceed to questions. Just a couple of questions from me first as the chair. We'll, as we go through questions in the committee, I'll let you know who I'm handing the call to. We'll proceed in an orderly fashion where one person at a time will ask you some questions, so you know who's asking you questions at any one time. First question from me is, in your submission, you refer to racism as a public health emergency. Can you explain why? And what is the link between health and racism?
So the Australian Public Health Association deemed racism a public health emergency, and we support that. The link between racism and health: racism triggers stress responses in our body and the release of stress hormones, so things such as adrenaline and cortisol. Those particular hormones increase blood pressure, they increase our blood sugar levels, they make us store fat, just as an example of some of the things that it does. If you experience racism over and over again, your stress hormones remain elevated. They don't have time to recalibrate to the normal levels, and therefore your body is constantly under stress. It leads to what could be considered a wear and tear on the body, if you like, with prolonged high blood pressure, increases the risk of developing heart disease or stroke or kidney disease. With prolonged elevated blood sugars, it starts to increase the risk of insulin resistance and possibly diabetes. So there's very biological consequences of experience of racism due to prolonged exposure to our stress hormones.
It's very helpful to be speaking to a doctor to understand what the biological impacts of racism are. I don't think there is like an understanding or appreciation that it actually does have it's not just a mental impact on somebody when they experience racism, there's a biological impact on the body. And psychological impacts, because if you're going into a situation where you're anticipating you may experience racism based either on your prior experience or the experience of a family member or a loved one, then your stress hormones go up. So, and you become anxious. It's all very interconnected and interlinked. And we do often talk about the psychological impacts, which can't be understated. But we need to also understand how it manifests in the physical ill health of Aboriginal and Torres Strait Islander people. And are there different impacts on kids? I suppose I'm wondering about the impacts of how it accumulates over time, over the life of an individual, and I think we certainly understand that there are intergenerational impacts of trauma. I suppose I'm wondering, what's that impact on our kids when they're in classrooms or in the very early years of, postnatal care or whatever it is, all the way through to adulthood. If you are growing up in a space where you are exposed to constant racism.
And I think that's a really good question. I would like to, if it's all right, I'd just like to read out something that was sent to me regarding, I'm hoping that you're talking to the Lowitja Institute. They did a publication on racism and the health and wellbeing of Aboriginal and Torres Strait Islander children.
Sorry,
and it was a longitudinal. This was released this year.
Sorry, who released it?
The Lowitja Institute.
Oh, the Lowitja Institute. Yeah, that's completely fine.
Yeah.
And you're also welcome to provide the document on notice too, if we don't already have it.
So we might do that as well. But their particular publication that they researched examined how much of the mental health and sleep disparities between Aboriginal and Torres Strait Islander children and non-Indigenous children could be explained by experiences of interpersonal racial discrimination. And their findings noted that removing interpersonal racism could greatly reduce mental health and sleep problems for Aboriginal and Torres Strait Islander children. And they estimated that it could reduce it by about 1/4 to almost a half of these inequities. I think it's quite astounding.
Thank you very much for that, and we'll take a closer look at the Lowitja report. One of the priority policy reforms you mentioned as well is investing in truth-telling. Can you explain why, from a health perspective, truth-telling is important?
Okay, so there's probably, firstly, I might talk about it from a patient perspective, if that's okay. People like to be believed, and people's stories are their stories. So I think that's really important. And if we, as healthcare providers, if we are to create a trauma-informed approach to our healthcare, then we need to listen and believe the stories that people share with us, often quite generously because they're quite traumatic. The second part of that is the clinicians, and the clinicians need to understand the context of the patient, understanding that an individual doesn't survive and thrive in a bubble. They do that within a family and within a community. And the community and the family have their stories, their history. For Aboriginal and Torres Strait Islander people, those stories and those histories were not shared among the broader population for various reasons. And the truth-telling and sharing of those stories allows clinicians to be able to understand the patient's perspective as to why they either choose to engage or not engage with the service, why they choose to or choose not to engage with a service that someone has referred them to. And it enables the clinician to be able to meet the needs of the patient where they're at or find an actual alternative. It enables clinicians to be able to provide culturally safe care, which is care that has been deemed culturally safe by the patient, rather than the clinician saying, I have done what I need to do to fulfil culturally safe care, because we know that it is determined by the patient and the community.
Thank you.
I'm not sure if I've answered your question.
No, that's that's okay. If there is anything in addition to what you might have wanted to say this morning, you're welcome to provide any additional information on notice too. But my final question before I give other committee members an opportunity to ask some questions too, and you kind of touched on this a little bit, I think, in your previous answer, talking about, I suppose, what constitutes culturally safe care, I imagine, is connected to this. You recommend regular reporting by health services on racism and anti-racism initiatives. What would you want the reporting to capture? And in terms of what we're not capturing now, and what difference would it make?
Yep. So I think from the perspective of cultural safety, it needs to be capturing the patient, the family and the community's experiences. Having an anti-racism policy or complaints process doesn't mean that you're providing culturally safe or anti-racist care. So it very much needs to be from the perspective of the patient and the individual. And from, some of the discussions I have with community and researchers and doctors, some of those other measures would be around things like communication. Was the communication effective? Was it, and was it absent of jargon and all those sorts of things that are very biomedical barriers to communicating effectively to patients. I think around people being given time to make decisions on the best approach for their health, and did their worldview and holistic idea of health, was that respected and incorporated into the provision of their care? That'd be just a few things, but there's plenty more that I'm sure you'd find in the research that adequate measures to assess cultural safety and anti-racism.
Thank you. Appreciate that. I'm going to share the call and go to Mr. G.
Yep, thank you very much for your evidence and also for your very comprehensive submission. You mentioned earlier in your recommendations the need for greater accountability in health pathways with respect to racism. I'm just wondering if you could provide us a little bit more detail on that issue.
So sorry, I couldn't quite hear that well. Greater accountability.
Yeah. In health pathways?
So in health pathways or in...
Well, greater accountability generally, I think, was one of the three recommendations that you really wanted to impress upon this inquiry.
Yeah, so at the moment, accountability in the mainstream healthcare sector would be around ensuring that there are pathways for safe reporting of racism, and whether that's racism experienced by patients or racism experienced by healthcare providers, I think is quite important, because often our Aboriginal and Torres Strait Islander healthcare workers are working in that same culturally unsafe system that our Aboriginal and Torres Strait Islander loved ones are receiving care from. And so accountability, it's around the actual reporting pathways.
Right.
And I think, while those reporting pathways need to be confidential, there needs to be some sort of, transparency around it as well. But it's a very difficult, if I look at it from the perspective of my medical colleagues, it's very difficult to speak up and say that you've experienced racism, and because one, you're not sure how that'll be received, two, you're not sure how that will be managed. And it can be quite re-traumatising for, past experience as well. So, and people don't want to be defined by their experiences of racism. When they've, many of them have achieved fantastic things professionally that should also be acknowledged, the strength and resilience that they've come through some really challenging circumstances to achieve what they have.
Thank you. And in terms of initiatives to combat racism which work within the health system, are you able to point to any examples that have proven to be effective?
That might be something that we will have to take on notice. It's a difficult question. I think I would like to probably just highlight the Yagilawagamba program that the college has and our partnership with the Indigenous General Practice Trainee Network.
Yep.
And that's an exam prep program, and it sounds very simple when you say it like that, but it develops a lot of collegiality. It develops a lot of, it develops and it reinforces our GP's cultural identity and the strength through that. And we are seeing results from that particular program with more and more of our GP trainees successfully completing their exams. Some of them, a lot more in their first attempt. So they're completing their training much quicker than what they were previously. So that's one small part of the puzzle, and I know it seems very small, but the more Aboriginal and Torres Strait Islander GPs that we have there, out there working, the more we can create culturally safe spaces for Aboriginal and Torres Strait Islander people to receive care.
Thank you. Yeah, it looks like the college does have a number of important initiatives underway in that respect, so I commend you for that. On page 7 of your submission, you've stated that racism costs almost $38 billion a year to the health impacts. Are you able to provide some more insights into that and the cost to the health system from racism, either directly or indirectly?
So that one I will either have to throw to Kate or take it on notice, and we can give you some examples of the actual where some of those costs will be. And I'm assuming that some of that will be through things such as misdiagnoses, people not having treatment, and then there'll be some other things. Kate, did you have anything to add?
Yeah, so that statistic comes from a study by the RMIT University, and we would be very happy to provide some more detailed information around that because it's a really important question.
I suppose the more general point, though, is you've given evidence today about the health impacts of racism, and there's also an impact on financial cost onto the health system of racism in terms of dealing with all of that and the worse health outcomes that you get. So thank you for highlighting those issues in your submission. I thought it was very comprehensive.
Thank you. And I think just on that point, if I may, Karen described the health impacts of racism. There's also the preventing, racism also prevents access to positive health determinants. Social, cultural, environmental, economic determinants of health and well-being. So that's a flip side as well.
Thank you, and I commend the college for taking such an active interest in this issue and the work of the committee. Thank you.
Thank you, Mr. G. Senator Thorpe.
Chair. Thanks for appearing today. You argue that racism is a public health emergency. Is it treated by governments, particularly Queensland Health, as a public health emergency? And if not, why not?
I'm not. So we are a national faculty centre. We look at things from a very national perspective, and from a national, I might talk about our faculty if that's okay. So our faculty has been in existence for 15 years. Before that, we were an Indigenous health unit within RSEGP, and we have always had Indigenous leadership when we were an Indigenous health unit, and now that we're a faculty. For most of the existence of the faculty, racism has been seen as an important cause of the disparity of health in Aboriginal and Torres Strait Islander people. And during that time, we have advocated for racism to be addressed. We're very pleased that it's becoming, a focus, and we're very, very pleased that the committee, the standing committee, chose to do an inquiry into this, which is why we've done a submission. We have, as I mentioned in the opening statement, in the National Guide to Preventive Healthcare for Aboriginal and Torres Strait Islander people, we have a chapter on racism and what GPs and healthcare providers need to do to address racism, the health impacts of racism. And this is being developed by researchers and an expert advisory committee as well. What we would like to see is adequate funding, proper funding to enable proper care for Aboriginal and Torres Strait Islander people to occur, and that takes time. It takes time to develop rapport, it takes time to develop trust, so that the health impacts of racism can be addressed, and not just the immediate experiences of people, but to be able to discuss the preventive health measures that are needed, to be able to have the time to discuss why cancer screening is so important, why people should take that time out of their busy lives to undergo, the screening or the blood test for their cholesterol. It takes time. I think it is a difficult subject. It is an uncomfortable subject. And it's one that our college, through the leadership of Aboriginal and Torres Strait Islander doctors who work within the college and also who work with the faculty, have pushed our college to sit in that space of discomfort to do. And we have conversations with government. We would like to see a tool be funded so that we can measure the impacts of racism in primary care. I might just share, it was in the submission, that our Health of the Nation report, which is a survey that's sent out to our members once a year, 30% of our members who responded reported either witnessing or experiencing racism in primary health care. So it's something that's pervasive, it's throughout all our health system, and we need it addressed.
Thank you. Are there any consequences for doctors or practitioners being racist towards their patients?
So APRA, our regulatory body, they have a complaints process in place where people can complain should they experience any racism from their healthcare provider, and that's any healthcare provider that's registered with AHPRA. It's not just doctors, it's nurses, it's physios, pharmacists. So AHPRA does have a process that, to my knowledge, and I can't tell you how many, but there have been complaints that have gone to AHPRA due to racism experiences from patients. And the only, so that's it. I can't tell you that number, but the only, there was a very public suspension of a doctor for 12 months, and I can't remember what year it was. Kate might have a better memory for it. It might have been 22 or 23, and a doctor was suspended because of a racist email that they sent.
So are they put on a list so that our people don't go to racist doctors? Like, how do you know which doctor's going to be racist and which one isn't? And do they, following on from that, are they encouraged to do anti-racism training so that they just don't be racist?
Yeah, so I think you'll have to, I can't answer those questions, I don't know, so I think that might be something either we can find out for you, what AHPRA's processes are, or we can probably do that. I know from, all I can tell you is from
your organisation, is it encouraged for all the practitioners to not be racist and do some training to understand their racism?
Yeah, I see where you're coming from. Yeah. So our organisation, we do, I might start with our trainees, our doctors our GPs in training. They undertake cultural safety training, and they, that is done through the Joint Colleges Training Services, which is a partnership between RACGP and ACRM, which is the college, Australian Rural and Remote Medicine College. So they do that. That is done by cultural educators and cultural mentors. And there are a significant number of Aboriginal and Torres Strait Islander GPs involved in that training as well. So all our trainees undergo that. They are expected to continue their cultural safety education, and that is done through what we call continuing professional development points. And in the submission, we have a list of what our CPD offerings are. Some of those are around clinical audits. I might talk about the most recent edition, which was following a journal article in the Australian Journal of General Practice, which was about racism, and that's new chapter in our fourth preventive guide. There's been a huge uptake in a particular CPD offering. Apparently, I was talking to one of the people who run CPD in our college, and they said it's one of the most popular CPD items so far this year. And the other thing that we require of all GPs who are members of RACGP is that they are to have done some cultural safety education. That is a requirement of their CPD that needs to be completed and marked as completed.
Can I ask about the cultural training? I've seen a lot of cultural training in my 50 years, and some of it doesn't even talk about racism. So in the cultural training, does it call out racists and racism and how racism kills our people?
So I cannot, because it's done through that Joint Colleges Training Services, I haven't got a curriculum in front of me. I know that there is a lot of talk around bias, identifying your own bias, and that critical self-reflection, which is in line with AHRA's definition of cultural safety, one component of cultural safety. So it is around challenging people's worldview, to understand that their worldview is not shared by everyone, and to reflect how they may be bringing their worldview into that consultation space when they're seeing people.
Would you mind taking that on notice and providing any further information on the training?
Yeah, of course.
Possible, please. I've just got two more questions. Some solutions seem so obvious, straightforward. Our people have been saying it since invasion. Our community-controlled organisations from the 60s and 70s have been saying the same thing that we're still saying today. But one example is that I've been pushing for improved access to medicines in prisons for years, given high populations of our people, deaths in custody. So access to medicines is very rare in a prison these days, particularly for our people. This action can be done by the Minister listing more medicines on Section 100. He has the power. He has the ultimate power as one white man in the federal government that runs health in this country that can sign on a piece of paper that puts medications in prisons tomorrow. This is life-saving medications such as for diabetes and should be an absolute no-brainer, yet there's no action on it. So why do you think that the health minister in this country, why is there no movement on life-saving medication for Aboriginal people who are the most incarcerated people on the planet? So if we have a health minister that doesn't really care or pretends to care, what can we do? Why is there no action on this?
I'm not sure I can answer why there's no action in terms of how other people feel.
What's your view?
I would like to see better health in all spaces. So the health of our young people, the health of people in hospitals, the care that they get, and that does also include people who are either in detention or who are in our prison systems. I think there needs to be the provision of culturally safe care in those spaces though, because even if there is access to medication, if the care that's delivered is not being delivered by someone who that community or that population trusts, that's still a significant barrier. So I would like to see cultural safety be part of that. And I'm just sort of, as you're talking about this, reflecting on some of the experiences of my colleagues who work in these spaces, and they work very hard at building trust and rapport for patients that they look after who already don't trust, and they're working as part of that particular system. I think the transition care and the transition care from the prison to the community is actually quite a high risk space for people to navigate, because who do they go and see, and the transfer of information and the sharing of information as well. So I think there's quite a few things that need to be managed, and I'm fairly sure that there was a discussion about this with another committee. I'm not sure if Katie's able to share. It was not one that I was part of, but yeah.
Yeah, thank you. That's if they make it out of prison. A lot of our people don't even make it out of prison, but that's something else. Incarcerated women, especially our women, when giving birth or undergoing a gynecological exam and other kinds of women's business screenings, are being shackled while they have these treatments or while they're giving birth. Is this something that the RACGP supports, or is it something that you've spoken out about, or is it something that you know about, or is there something you can call out so that our women aren't put under those circumstances in systems?
Yeah, so personally, it's not something I've heard about. So it's something that I might have to take on notice and, yeah.
That'd be great. Thank you.
Thank you.
Thank you, Senator Thorpe. That concludes the time for questions that we have. We've gone a little bit over, so I appreciate you sticking around. You've taken questions on notice. If you can please forward those to the Secretary by the 19th of August, they'll also be in touch with you about those. And if there's any additional information that you think would be helpful for the committee in our deliberations, you can take the opportunity to forward that along as well. From today, you'll be sent a copy of the transcript of your evidence, and you'll have an opportunity to request corrections to any errors that you find there as you're reading through it. So thank you very much again for your time this morning. Appreciate it. We will now suspend very briefly for a morning tea break and return at 11:05. We will now resume from our morning tea break and return with the New South Wales Office of the Children's Guardian to give evidence. For the Hansard record, would you please state your full name and the capacity in which you appear?
My full name is Bianca Dufty and I appear as the Deputy Children's Guardian with the Office of the Children's Guardian here in New South Wales.
Thank you very much. I've got a short spiel I need to read out and then I'll invite you to make an opening statement. Although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as contempt of Parliament. The evidence given today will be recorded by Hansard and attracts parliamentary privilege and is being broadcast live on the Parliament's website. I'm joined in the room today by Senator Thorpe, Mr Smith, Ms Cook and Mr G, and myself as your chair, Senator Stewart. I now invite you to make an opening statement.
Thank you, Senator. Chair and members of the committee, my name is Bianca Dufty. I'm a Namba Andrew Milleray woman and the Deputy Children's Guardian at the Office of the Children's Guardian. I would first like to acknowledge the traditional custodians of the land that I'm meeting with you on today. I'm on the lands of the Gadigal and I pay my respects to Gadigal elders and ancestors, many of whom were the first point of contact in 1788. I also acknowledge my own ancestors and elders, the Namba and Milleray people. I particularly acknowledge my Nan Lizzie, who was taken from her family at 2 years of age, sent to be a domestic servant at the age of 12 before spending time at Cootamundra Girls' Home. It is her story, like the story of many of our ancestors and old people, that gives reason and meaning to the work that I do. Thank you for the opportunity to appear today and provide a brief statement on behalf of the New South Wales Office of the Children's Guardian. I acknowledge the significance of this inquiry and its focus on addressing racism, hate and violence directed at Aboriginal and Torres Strait Islander people. The OCG is the independent regulator responsible for helping make organisations safer for children in New South Wales. Our functions include administering the Working with Children check, regulating and supporting organisations to implement the Child Safe Standards, overseeing reportable conduct and child employment schemes, accrediting, monitoring and regulating out-of-home care and adoption service providers, and in addition to our child safety regulatory role, we also administer NDIS worker checks. These functions rely on systems that are trusted, culturally safe, accessible and responsive to the lived experiences of Aboriginal and Torres Strait Islander people. At the OCG, we have a responsibility through prevention, education and regulation to help ensure that systems designed to protect children do not inadvertently contribute to harm. Through our engagement with child-related organisations, employers, communities and out-of-home care agencies, the OCG has observed how systemic and structural racism and culturally unsafe practices have impacted and continue to impact Aboriginal children, young people, adults and families. This is particularly evident in out-of-home care, where Aboriginal children make up approximately 7.8% of the child population in New South Wales, but more than 48% of children living in out-of-home care. Progress towards closing the gap target 12 remains off track. These figures are not simply statistics, they are indicators of systemic failure and reflect the enduring impacts of colonisation, dispossession, intergenerational trauma, systemic racism and structural disadvantage. Professor Megan Davis, in her Family's Culture Review report, highlighted that the disproportionate number of Aboriginal children in care is not solely the consequence of individual circumstances, but is also influenced by systemic practices, policies and decision-making processes within child protection systems themselves. As Aboriginal people, we know, and the ACG has consistently heard from Aboriginal designated agencies and Aboriginal child safe organisations, that Aboriginal kids are safest and have better outcomes when they remain connected to family, community, culture and country. Cultural identity and meaningful relationships, culturally safe care arrangements, are not additional considerations. They are essential protective factors that support safety, well-being and lifelong outcomes. A recent example of the OCG's regulatory work has seen an increased focus on the quality of cultural connection and care provided to Aboriginal children in out-of-home care. This has included examining whether the agencies we accredit, monitor and regulate including the DCG out-of-home care practice, are effectively implementing the Aboriginal and Torres Strait Islander child placement principle. While compliance with these requirements has improved across parts of the sector, the ACG's engagement with its stakeholders continues to highlight significant variation in practice and the need to move beyond mere procedural compliance towards authentic cultural connection. Our focus has shifted from asking whether a document exists to asking whether an Aboriginal child feels connected, knows who they are, where they come from, and has strong relationships with their family, community, and culture. Acknowledging the significant role self-determination has in addressing systemic and structural racism, in 2025, an amendment to our governing legislation enacted a guiding principle, Section 8, bracket E2, close bracket, of the Children's Guardian Act. This principle requires the OCG to consult with Aboriginal and Torres Strait Islander communities to consider and address the impacts of its policies, practices and procedures on Aboriginal and Torres Strait Islander children, families, community and community-controlled organisations. We've already commenced work to embed the guiding principle in our work. As part of our recent Working with Children Act review, we engaged an Aboriginal-owned consultancy to undertake consultations with Aboriginal communities and organisations across the state and provide recommendations based on those consultations. My team and I also regularly meet with key Aboriginal stakeholders, including ATSIA and the Families Culture Working Group, around systemic issues and trends and our policies, practice and procedures as they impact Aboriginal and Torres Strait Islander people. Significantly, our Child Safe scheme is due to be reviewed, having commenced in February 2022. The New South Wales Child Safe scheme requires child-related organisations to proactively create and maintain child-safe cultures through implementation of the 10 Child Safe standards. However, New South Wales does not have a universal standard, as some other jurisdictions do, that requires child-safe organisations to provide an environment that promotes and upholds the right to cultural safety for Aboriginal and Torres Strait Islander children. The ACG would support consideration of the inclusion of a universal principle that explicitly recognises the right of Aboriginal and Torres Strait Islander children to cultural safety. Adoption of the universal principle reflects what we know. Culture, identity, family, community and connection to country are protective factors that contribute directly to child safety and well-being. Importantly, adoption of a universal principle reinforces that cultural safety is not separate from child safety. For Aboriginal children, cultural safety is a core component of being safe, heard, respected and supported. For the ACG, cultural safety and self-determination are not separate initiatives. They must be embedded in how regulatory decisions are designed, made and reviewed. As an independent regulator, our responsibility extends beyond responding when harm occurs to strengthening the systems, practices and accountabilities that help prevent harm in the first place. This includes ensuring our prevention, education and regulatory actions are culturally responsive, that we work in partnership with Aboriginal communities and Aboriginal-owned organisations to strengthen the capability of the sectors we regulate, to provide culturally safe and responsive care that keeps kids connected to family, culture, country and community, and that this is central to every Aboriginal and Torres Strait Islander child's experience. Lastly, the OCG is in the midst of significant internal organisational change following the Special Ministerial Inquiry into the workplace culture of the OCG, authored by Kate Eastman AMSC and tabled in New South Wales Parliament on the 10th of September 2025. The inquiry examined the governance, leadership, complaints management systems, policies and practices of the OCG and specifically considered the OCG's relationship and engagement with its First Nations employees and their experiences in the workplace. The inquiry found that the OCG did not operate at a level of cultural competence and cultural safety the community as a whole and First Nations people in particular should expect, and that the cultural load of First Nations employees was overlooked and poorly understood, creating a risk to their sense of safety, wellbeing and security at work. Key initiatives that respond to the inquiry recommendations include a functional review to improve collaboration, accountability and information sharing, strengthening employee wellbeing and workplace culture measures, enhanced governance and risk management frameworks, investment in leadership capability, including recruitment of my role as Deputy Children's Guardian to lead reforms focused on First Nations leadership, inclusion and cultural safety. Since commencing in February 2026, my team and I have drafted a cultural capability framework which will be embedded in day-to-day OCG work practices. We've engaged an Aboriginal-owned organisation to undertake cultural capability and neurocultural training for staff. We've commenced a large project around cultural connection and cultural safety of Aboriginal children in out-of-home care, and we've re-established our First Nations staff network. This program of organisational change has also provided an opportunity for us to critically examine how our own systems and processes respond to racism and support culturally safe outcomes. In closing, the ATG is committed to strengthening regulatory practice so that child safety systems do not perpetuate the harms they seek to prevent, and that children, families, communities and staff are heard, respected and supported in decisions that affect them. Through culturally responsive regulation, partnership with Aboriginal communities and a continued focus on accountability, cultural safety and self-determination, we are committed to ensuring our work is culturally responsive, trauma-informed and contributes to better outcomes for Aboriginal and Torres Strait Islander people across New South Wales. Thank you. I welcome any questions.
Thank you very much for that opening statement. We'll proceed to questions and begin with Senator Thorpe.
Thank you, Chair. And thank you, Ms Duffy, for appearing today and the work that you're doing to make your workplace less racist. We are seeing, as you pointed out, high child removal rates. This was called out as genocide by the Bringing Them Home report and the Europe Justice Commission that happened in so-called Victoria. Do you agree that the removal of our children constitutes an act of genocide?
Thank you, Senator Thorpe. I think looking at the UN Convention around genocide, if we look at the 5 principles that it suggests constitute genocide, I think it would be hard to mount an argument that historically genocide of our people didn't occur. I think, killing of a group, causing deep physical or mental harm, making life so hard that a group will die, stopping babies from being born and taking children away by force is what the UN says constitutes genocide. So thinking about our history, I think anyone would be hard-pressed to make an argument against genocide, and I think we see the impacts now of our history. We continue to see Aboriginal and Torres Strait Islander children removed at a rate that's significantly higher than non-Aboriginal children. We continue to see both our young people and our men and women overrepresented in custody. We have poorer life outcomes, we have poorer health outcomes, and we have poorer education outcomes. So I think what I would say is we continue to see the impacts of what's occurred in our history through colonisation and dispossession. And as I said, I think it would be hard to mount an argument that our history doesn't include genocide or attempted genocide of Aboriginal and Torres Strait Islander people.
Thank you. Do you think the removal of our children by the systems is deliberate? Is the system built to do exactly what it's doing?
I can, perhaps if I draw on my previous function as a child protection lawyer who spent many years assisting adults and representing children and young people in children's court proceedings. I think if we look at the history of child protection in New South Wales and where we have our Department of Communities and Justice now, I think the root of that organisation really came from the Aborigines Protection Board. And so I think I'm aware that the Department of Communities and Justice are undertaking significant internal reform that includes anti-racism work across all levels of their staff. So I suppose it's deliberate in a sense that they are intentional decisions. I certainly think that there's been a real shift in more recent times in New South Wales to really looking at the prevention aspects and the partnership aspect of the Aboriginal and Torres Strait Islander child placement principles. And we've recently seen significant reform announced which will really shift the focus from removal into that early intervention space, which really means that we should be seeing less of our kids coming into out-of-home care and more kids staying with family and family being supported to keep kids at home.
Thank you. And just on that, your role includes detection and action on non-compliance by government agencies. So how much does the New South Wales so-called child protection, I think it's child stealing or child racketing, does the New South Wales child stealing system comply with the Aboriginal child placement principle? So how much does that actually work in New South Wales?
So in terms of our role at the OCG, we accredit and monitor out-of-home care providers. So there is part of DCJ here in New South Wales that does provide out-of-home care services. And so what that means is we're able to, we sort of monitor their compliance with our code of practice. So if there was a particular district of DCJ that we say doesn't meet its accreditation requirements, then we can place conditions on that particular district, and we certainly have done that in the past. I'm not sure, but I can take on notice as to whether or not there are any current DCJ districts that are subject to sort of any accreditation conditions, but we do look at their practice around the Aboriginal and Torres Strait child placement principles as it applies to kids who have already been removed from their family. So I suppose we don't monitor and accredit or have oversight of what happens necessarily before kids are in out-of-home care. That's something that other agencies in New South Wales would have greater oversight of through their oversight functions.
Thank you. And my final question before I hand it over. Would you support the national legislating of the Aboriginal child placement principle so that states and territories cannot step back on that commitment? We see, racist Northern Territory government get rid of the child placement principle so that more of our kids can be removed into white families. And we see Queensland following very close behind. So we've got two very racist governments committing genocide against our people through stealing our children. So should there be national legislation so that no state or territory can ever remove it unless it's through the federal parliament?
Thank you for your question, Senator Thorpe, and it's actually something that, as an Aboriginal person sitting in the role that I do, is something that's been at the forefront of my mind since the Northern Territory introduced the bill that's now unfortunately been passed. We did make a submission to the Northern Territory Legislative Scrutiny Committee in partnership with the Advocate for Children and Young People here in New South Wales. And in that submission, we made it clear that we did not support the repealing of any aspects of the Aboriginal and Torres Strait Islander placement principle. So for, I suppose in response to your question, we would support national legislation that embedded the placement principle across all state and territory jurisdictions such that it can't be repealed. And what I would say is significantly our minister came out strongly in support of the child placement principle last week, along with federal and other state ministers supporting the child placement principle and really sort of pushing back against the recent bill that's now been passed in the Northern Territory. So I think, in short, yes, we would support national legislation.
Thank you very much. And thank you for sharing your story at the beginning.
Thank you, Senator.
Thank you, Senator.
Ms Cook.
Thank you, Ms Dufty. My name's Cara Cook. I'm the federal member for Bonner in Queensland. Thanks for giving your evidence today. That was really powerful as well, sharing your story at the start. I want to go straight to the fact that many of the submissions and evidence that we've received as part of the inquiry have raised very, very serious concerns about the removal of Aboriginal and Torres Strait Islander children from their families. You've spoken just now about supporting legislation at a federal level for the child placement principle. What else can the federal government do, in your view, to stop the harm and racism?
Thank you for that question. I mean, I think that's a really challenging question, I think, because arguably there's probably quite a lot in terms of child protection. I think one of the difficulties is we have child protection sits across state and territory jurisdictions, and perhaps one of the difficulties is, I think, as safe and supported agreement would show, there's such variation in practice, and it's difficult when there's inconsistent practice. And I've spent time speaking to people who are in border communities, for example, who talk about the difference between different states and their application of child protection law. And so I think looking at ways in which we might be able to have a more consistent approach to child protection definitions and law makes a lot of sense. I think, one of the other things that we've been speaking about recently is the Child Safe scheme in New South Wales and how we, in our practice, although we don't have the universal principle at the moment, how do we ensure that our Child Safe organisations are really ensuring that Aboriginal and Torres Strait Islander kids are safe, culturally safe, they feel supported, they feel seen, and they feel heard in their Child Safe organisations. And so I think, again, we do have the 10 Child Safe standards that are were from the previous Liberal government, I think, in 2019. But it would be great to see, I think, the inclusion of a universal principle for Aboriginal and Torres Strait Islander children in the federal Child Safe scheme or Child Safe principles. I think all of these changes to laws are great and positive, but I would sort of go back to the idea about a piece of paper or a piece of legislation doesn't mean that those changes and practices are embedded in practice. And so I think it also means that we need to see better reporting, not just for child protection, but for all of the factors that impact on why child protection might become involved with a family. So that includes reporting around and programs around, reducing domestic violence as it impacts women and children. How do we look at reducing, incarceration? For me, if we want to get serious about improving the lives of Aboriginal and Torres Strait Islander people, then it starts from birth. It starts from, making sure that a child isn't removed from their family, because the minute a child safety is involved with a family, you change the trajectory of that child's life. They're, surveilled more than they would otherwise be. They're more likely to enter custody, and once somebody or a young person enters custody, then they're more likely to enter into adult custody. And so really we have to get it right at the start. So all of the things, all of the work that we do, I think, in the child protection space, really, if there's a more coordinated effort at a federal level that brings states and territories in and along on a journey that really is about early intervention and supporting children to stay with families, and I think that would be the most significant foundational reform that I think would bring about the most impact.
Thank you. Do you have any views about the embedding of international conventions into Australian law?
I don't. I haven't, to be honest, considered that, but I'd certainly be happy to take that on notice and provide a more fulsome response.
With your oversight of some of these organisations. Can you talk about the practicalities of what would happen for a child that experiences racism? I mean, there's two arguments there. One, that it's inherently racist within the system itself, but also if they do experience racism inside an organisation you have oversight of, what practically happens? What investigative powers do you have?
Yeah, so there's a couple of things that happen. So we have a couple of schemes that might sort of avail themselves of those particular scenarios. So we have a reportable conduct scheme, and that's really around, I suppose, oversight of organisations to undertake their own investigations when an allegation of reportable conduct has been made. Now, if racism was to occur and there was psychological harm that had been caused to a child, which of course racism is absolutely causes psychological harm, then we would expect there to be an investigation undertaken by that particular agency. And if we can step in and pick up those investigations, or we can have an oversight function of those investigations. If that particular conduct perhaps was in relation to a carer, so a child in out-of-home care, then that may have impact on whether or not that person continues to care for that child, because they may no longer be authorised as a carer. It may have impacts on their working with children check, because they require that to be an authorised carer. So there are those flow-on impacts from that particular reportable conduct type investigation. From an out-of-home care accreditation and regulation perspective, we can, and we certainly have in the past, received complaints from young people, and some of those complaints have included sort of racist, whether it's racist practices or discrete racist events that have occurred. We sort of respond to that child and young person, but we also then look at out-of-home care agencies, making sure that they're taking action to respond to those particular concerns that have been raised by that child and young person. So we'd also then be looking at how agencies respond and manage, those types of practices that are coming to the fore. So we definitely also want children and young people in either one of those scenarios to know what their rights are, that particularly out-of-home care agencies are letting kids know what their rights are and where they can raise concerns in a safe environment. So there's a number of sort of practices that we undertake, but what I'd also probably like to share with the committee is that my team and I are undertaking a pretty significant piece of work around cultural connection and cultural safety for Aboriginal and Torres Strait Islander kids in out-of-home care. And what we hope part of that will do will be really to set a benchmark, particularly for non-Aboriginal designated agencies, around ensuring cultural safety and cultural connection for Aboriginal kids in out-of-home care. So part of that will be a bit of an exercise in understanding what the practices of those agencies are, but then looking to our Aboriginal designated agencies to share their proud practice around cultural safety and cultural connection. And really, we're never going to have a non-Aboriginal designated agency be able to provide the same level of cultural connection and cultural safety that an Aboriginal designated agency can, because it's not, I suppose it's not. Aboriginal people share our culture, we have an authentic and lived experience about what culture is, and that can't be replicated. But what we can do is support our non-Aboriginal designated agencies to be the best they can be in providing that cultural connection and cultural safety. So that'll include sort of resources, it'll include us providing feedback, it'll include Aboriginal designated agencies sharing what their practices are, so that hopefully what that means is we don't have kids coming in talking to us about having been subject to racism or structural racism because of the care that they've received.
How many out-of-home care providers do you have oversight for in terms of your accreditation and oversight?
I'm sorry, Ms Cook, I missed the first part of that
it
question.
was how many out-of-home care providers do you have oversight for or have accredited as an organisation?
As of today, it's just slightly over 90.
And how many of those have you received complaints about racism?
I need to take that question on notice, Ms Cook.
Thank you. Thanks, Chair.
Thank you very much. That concludes the questions that the committee has for you this morning, flagging there also might be additional questions on notice from committee members as well. And if and when they do come along, if you can please respond to those by the 19th of August, the committee would be grateful. You'll be sent a copy of the transcript of your evidence from today, and you'll have an opportunity to request any errors that you find in there once you've had a read through it. So thank you very much. We will now take a very short suspension while we welcome our next witness to the table.
Thank you, Senator and committee.
Thank you. All right, I'll get my little spiel. You've already heard it a couple of times this morning. I'm going to say it again. Thank you. I now call on Mr. Barry Walden. Is that right? Is that how you say your last name? To give evidence. For the Hansard record, would you please state your full name and the capacity in which you appear?
My name's Barry Walden. I'm from Doomadgee in the Gulf Carpent area. I'm here probably to give evidence around I suppose the racism that's been going on for quite a while, in particularly, and my interest is obviously the Gulf, and what I've experienced personally too as well.
Yeah. Thank you. Now I've got a short spiel and then we'll get to some questions. But although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as a contempt of Parliament. The evidence given today will be recorded by Hansard and it tracks parliamentary privilege and is being broadcast live on our Parliament's website. You can see from the name tags that we have on the table who's joining you in the room. We have Mr. Chaffey also joining us via teleconference. I will now invite you to make an opening statement.
Yes, look, first of all, I really do appreciate the committee for allowing me to obviously participate. I thank you, and particularly, like I said, from me personally, it has been quite a, I'd say, struggle, and particularly just it's just needs to be addressed, because if it's not addressed, obviously this will continue to play out, particularly in the remote communities, the discrete communities too as well. So obviously, like I said, I take this with open arms in regards to thanking every one of you guys, the committee, for allowing me to participate in this and giving evidence. Thank you.
Do you want us to proceed to questions now? Is there any other opening statements that you would like to?
Well, I mean, I suppose, yeah, I can.
Yeah, excellent. We can go to questions.
Yes.
And I might begin with Senator Thorpe.
Thank you, Mr. Walden, for appearing today. You are one of the founders of Gunawanna Jungai. Is that correct?
Yes, that is correct.
Can you briefly tell the committee about the organisation and its purpose?
Yeah, so back in 2022, if I can be a bit more specific and exact, I had the opportunity to go to the government and ask to have a committee or a place-based partnership with an organisation that I was going to set up in the Gulf of Carpentaria, up in Dumaji, Gunumuni Jungai. I might just specifically just give you a rundown. Gunumuna meaning children, Jungai meaning traditional owners in my Gangli language. To set that up, we needed members of the community to specifically have more connection or communication with government and working a lot closer with government around most of the issues, and obviously engaging a lot more closer with service providers too as well that are delivering services in our community, such as Dumaji. So that was the purpose of it, but particularly just to give community a voice. Yep.
Thank you. Since I've been in this job, I've spoken about the amount of black money from the federal government that goes to cops, racist cops. It goes to Clontarf Foundation, which is not a black organisation. Millions of dollars, ongoing they get. NRL get millions of dollars. AFL get millions of dollars. And the Brisbane Cowboys get millions of dollars. So do you get millions of dollars for the work that you do with children? And can you tell the committee about some of the difficulties that your organisation, an Aboriginal community-controlled grassroots organisation, what the difficulties are for you around securing funding?
Yes, and thank you again, Senator. Look, particularly, I think where we struggle a lot is advocating for ourselves, particularly from the fact of we're an organisation that is built off the fact community control. It's community controlled. Every inch of it is community controlled organisation. We are the only ACO that exists in the Gulf of Carpentaria, and our funding that we try to get is where I feel as though that there is so much distrust and dishonesty with having an organisation such as Gunumuni Jungai to lead the community, and remembering we are leading our community leaders, future leaders, to something that is very, very rare that, you know, we have never ever achieved in our lives, is being leaders of our destiny in our own communities. And this struggle has been happening from 2021 to 2026. We still haven't got funding for an organisation that is community controlled, organisation that is built around the community and the family structures of this community. So this is where the government fails to recognise that. The government is failing, and they continually to fail because they're not recognising our cultural structures compared to the Western structures. So that's where we're having problems, and we've had this, like I said, for the last 3 years now, maybe 4, I think, yeah.
So are you telling us that your people, your elders, your community know better to run leadership programs than the NRL and the AFL, because they get millions of dollars to run leadership programs for Aboriginal kids? Are you saying that community-controlled, grassroots, self-determined, through our old people, teaching our kids is a better option and should be funded accordingly?
Yes, and I believe so. I hold my hand on my heart, and I could definitely say that to every one of you guys sitting here now.
What's the difference?
The difference is because it's community-driven. It's community-driven because our structures are all community-driven. It's all culturally driven. And outcomes, just remembering, we don't pay billions and billions of dollars to go down and give cultural awareness training to any one of those people that you're talking about, Senator. We don't go down and give those cultural inductions to people that are coming into our community, because the fact they've already got a hereditary one that comes into our communities and tells us this is the best way we're going to deliver. Well, that is not good enough for us. That's racism at the highest level. And this has got to stop, because we are the professionals in our communities. We are the ones that lead our children. We are the ones that give that cultural authority. We do that. Not any NRL, AFL, anyone for that matter, because it's not right. You know? So that's where I stand with this. And thank you for asking, Senator.
Thank you. When this inquiry heard evidence from experts in Darwin, so-called Darwin, some committee members seem to have the view that the only way to achieve law and order, right way, in society is through the brutalisation of our people by the cops. Can you tell us about the results of community policing in Doomadgee and why this model is better for our people than the colonial racist police force?
Yes, no, thank you again, Senator, for that, because just speaking from experience, I used to be an Indigenous police officer in Doomadgee. I did it for 10 years. We ran our own court systems, our local court systems. We had JPs to run those. We had our own procedure in how we dealt with our community. We didn't have high rates of people going to jail, I can guarantee you that, because I was the senior constable, and we used to run it in accordance with families, community, and obviously the people that were actually involved in the justice. So right about now, we have too much people going to jail because we cannot police our own families like we used to do before. And the only reason why I say it, because I was a community police officer for 10 years. We used to run our own court system with our JPs. So that's where the whole downfall is, because they don't believe that we have the rights as Indigenous Australians, First Nations, to have our own business or do our own stuff in our own communities, discrete and remote communities, which is pretty unfair and pretty racist to me. And like I said, I've experienced it, you know, and this again has to stop, because we're the destiny. We create our own destiny. We create our own outcomes in our communities.
Thank you. I just have one more question. I mean, I have a lot of questions, so I'll put a lot on notice. In 2022, an ABC report exposed the failures in the Doomadgee health system that led to a higher rate of rheumatic heart disease in Doomadgee than elsewhere. Of course, rheumatic heart disease has been virtually eradicated, meant to be, it is eradicated amongst white populations. Can you tell us about the health system in Doomadgee now? Has anything improved with the treatment of rheumatic heart disease in Doomadgee?
Not at the moment, and I'll just recuperate. In regards to the rheumatic heart issue, it has never been addressed in this manner, and we continually, the rates of rheumatic heart in each community up in the Gulf has risen due to the fact we did have an agreement with Queensland Health. They took our funding away from, and I speak, when I say they took it away from GJ, Gunawana Jungai, because we were working with the health to create the avenue between community and Queensland Health. They then pulled that funding away. Now the rates of rheumatic heart have risen within that short period of time. We did have a committee to engaged with community and obviously Queensland Health. That has now no longer exist, which is really sad because our younger children are now being treated for rheumatic heart, or they're not being treated at all. So it's quite a big problem, you know, in the Gulf of Carpentaria. And I speak from Doomadgee to Normanton, those three communities, Doomadgee, Mornington, Normanton. We have the highest rates of rheumatic heart now because they're not being treated for these things. They're not being looked after. So, you know, that's a problem.
I do have one more quick one, because none of the perpetrators have agreed to come to this inquiry. So the racist Queensland government have just declined to turn up. So we're hearing from the victim survivors, but the perps aren't here. What does that say?
Well, as far as I could see that, and obviously I don't know if everyone's seen the article that I did on Channel 9 around the systemic racism that goes on just in my community alone, just in the hospital in Doomadgee alone. And if I could just reflect on something, I had a 5-month-old grandson. He died because the fact systemic racism he suffered for 5 days, a 5-month-old Aboriginal baby. A 5-month-old baby, Aboriginal baby, died because his mother, my daughter, was refused medical attention for him. He died in my house. That's what racism is. It's hatred. They don't care about us. They never have. 65,000 years of it. And it's a hereditary thing. It's not because it happens one-off thing. It happens every time. It's got to stop. When do we stop it? Does it stop here now? After this inquiry? Another 20 years? I'm calling for it now. It has to stop. I wake up every morning thinking about my little grandson. I have his photo on my phone. Every day I wake up and look at him. Because systemic racism, they did not want to treat him at the hospital. They kept giving him Panadol, Panadol, Panadol. The shut-up drug. You know? 5-month-old baby that couldn't even talk for itself. That's sad. You know? Now, I say that as an Indigenous person. You close your eye and you think, if that was a white kid somewhere else, what would they have done? Every means of it, wouldn't they? Every means of resourcing that child and that mother with help. But because it's a remote community up in my area, just another statistic, you know? And it hurts. I have to live with it. Every day of the week I live with it. That's why I sit before you wonderful people here, because the systemic racism has to stop. And you think about the others that don't even have a voice here at the moment. What about them? What about those poor people? The people that are living on the streets here, the people that are down in the communities that don't get to say what I need to say, what I'm saying. What about those people? You know, they die with it. They turn to other things to make them forget. And then they're criticised for the way that they live. Well, that's shocking. And this has got to stop. Because I lived in that life before. I know what it's like to live on the street. I know what it's like to live the way some of these people live here. it's not good, you know. But if we can't help, then I don't know. But that's just me individually speaking. And thank you, Senator, for your questions. I appreciate it so much. Thank you.
Thank you, Senator Thorpe. Mr. Dew.
Yeah, thank you very much for your evidence. You've given very strong evidence about systemic racism. I'm just wondering what needs to change. What can be put in place to deal with this issue in your experience? I mean, you've been a community advocate for a long, long time. And I suppose it's a big issue going across many different sectors. But if you could point to a few key things that you think need to change to combat racism, what would they be?
Just 1 minute. Look, I think in regards to that, and thank you for that question. Look, I believe that in regards to that, we need to start working together a lot closer, particularly for the Indigenous First Nations people. And I heard a lot of comments around when I sat here in the first instance. There isn't enough advocating around expectations and cultural awareness. And when we talk about cultural awareness, we're talking about every individual Indigenous person's wants, needs, and trust. You know what I'm saying? In regards to that, because if you don't have that, or the competency, then you don't have nothing. You don't have no trust. And that trust factor and the understanding of structures, we have structures. Every Indigenous person has a structure. Everyone has a structure. It's just that how do we infiltrate that to understand the way that you deliver a service? Because if you don't understand it, how could you possibly deliver something as health and stop the systemic racism or racism as holistically if you don't understand who you're actually delivering or what you're delivering or providing to stop that? You know, we've got to work a lot closer, but it has to be worked together. And, you know, you can't have NRL coming in there, you can't have AFL coming in there and telling you that, oh, everything's okay with the hospital. It's not that. It's just remember, everyone, we live by this. We live by the fact that each individual person, regardless of who you are, we all make mistakes individually. You know, so individually, instead of working individually, we've got to work holistically all together to stop this from happening. Because if you have someone here that doesn't want to have anything to do with, for example, in my community, that does not believe that the community have the rights to talk or say, just remembering, you live in these little discrete communities or remote communities, they have structures within their families. Each family has an expectation and a cultural structure. And if you don't understand that, how could you possibly understand the needs and the wants of that community?
You've given very tragic and heartbreaking evidence today. You also mentioned in your opening comments about racism that you have experienced. Are you able to give further examples for people who may be listening to this broadcast of the racism that you have experienced?
Yes, definitely. Thank you once again. As the founder of Gunawuni Jungai, which was back in 2021, there was obviously some difficult personal stuff with me. I was actually forced to move out of my own community. I was forced by the police, by a justice system that continually fails. I was forced to go and live in another community.
Why was that?
Because of the justice system. Because the justice system is just as bad as health services and any other services that are failing us now. I was forced by court of law to go and live in another community. I had to walk away from an organisation that I built, Gunawuna Jungai, to go and live in another place so that I would not have any input into Gunawuna Jungai's admin and its day-to-day running. I was taken away from my community for 3 years, forcefully. I wasn't allowed to talk to anyone by court of law, to anyone in my community. I was told I wasn't allowed to. For the simple purpose, I wasn't allowed to infiltrate Dumuji. I was disadvantaged. As now, I didn't really address and really introduce myself. I am a traditional owner of Dumuji. I was born in the Nicholson River, only child ever to be born on the river without a hospital. Yet they took me away from my homeland. The same way we talk about the fact that children are taken away. That's what happened to me at an adult stage. I am 60 years of age and I was taken away from my community to disadvantage my community. And because, apparently, it was because I had too much influence in my community. And I was forced by the law, to tell me that I wasn't allowed in my community. After I buried my little grandson, 5-month-old grandson, the next day I was taken out. Didn't even get to grieve. That's why I grieve outside of that.
And lastly, the community policing model. You've been a community police officer. Is this something that, in your view, works, and that governments in particular should be supporting?
I think what should be happening is we all have internal structures. We all have ways of dealing with things and obviously operating in that manner. Now, if you had to get a structure and bring it into Dumuji, it'd probably only last a month.
Right.
The internal structure that we had.
Yeah.
That the policing service, that was for about 80 years that went for, before I became a community police. But it was a hereditary thing because once a family member left from there, someone else from that family actually went and sat on the police force because they were connected to these families.
Yeah.
So when there were bigger, high rates of fracture in families, they'd have certain police officers that were there that would engage in mediations or solving the issues.
Yeah.
That's not happening now.
Yeah. So community-led solutions.
It was always community. It is always community-led solutions.
Yeah.
It's just that no one's listening.
Yeah.
You know? And from my perspective, as I am now, and a traditional owner, nothing is working because community has not been allowed to have community solutions. Not even around the fact of setting up committees and having place-based partnerships with 3 tiers of government. Still not community controlled. You know?
Yeah.
We're still controlled by the government, who actually, end of the day, has the most mightiest thing. You know? And it's sad because we can't resolve some of our problems. And there's all homegrown problems. You know?
Thank you.
Thank you, Mr. G. Mr. Smith.
Thank you, Mr. Walden. Very, very powerful testimony. I want to touch on, I guess, education and the kids. 100% agree with you that, particularly in remote communities, kids have to be raised by culture. They've got to be grow that way. I've been the athlete that comes in and runs a clinic for a day and leaves afterwards, and it's tokenistic at best. Where's the closest high school to Dumuji?
The closest high school would be Mount Isa, which is a 6-hour drive.
Yep. So kids are generally boarding?
Boarding, most times.
So do you believe that the structures are in place for kids who have been born and raised in community. You know, they go away to boarding school, they may experience racism for the first time in their lives. They're a long way from home. You know, culture is completely, it's just non-existent in some of these places where they're going. Do you think those kids are being given enough support to succeed and thrive?
No, I don't think so, Matt, because the simple purpose is a lot of our children go away regardless of financial difficulty or sorry business within families. Those things are not being attended to, and I deal with a lot of the children, and I must say, as an Commonwealth Government employee, Indigenous Engagement Officer, when the first Closing the Gap initiatives come out in 2010 to 2018, I've seen a lot of things that have happened in those times, and a lot of it was basically around children who experience racism to the highest, and all they do is pack up and come home. And then it's sad because they don't want to go back to school, but it is so bad that our children only go to grade 10. Some of them go to grade 7. They probably only last a month because of the racism within the schools. And I know every school in Mount Isa because I grew up there, you know. And that racism, it starts as soon as they get not only to the school, but when they get to these resis and they stay in the resis. That's where it starts, because the people that are employed, damn it, they need to get proper employees, because our children are not immune to only seeing someone of different colour. You know, they'd like to see someone that they can relate to. That's not happening. And that's the biggest downfall with the education department. There isn't enough. I mean, they only got Band-Aid solutions for culture. Band-Aid solution is not a problem, is a problem because it's only for the time being. Someone else comes in and then it changes. And I've seen those changes. You know, from 2010 to 2018, I've seen changes in culture, just in my community alone. And children are not willing to go out no school because of that. They fear, they stay home, you know. So it's quite a big problem, you know. Yeah.
Well, if you can't get that education, then yeah, how are the kids meant to get ahead?
Well, I believe, you know, we've got enough kids in our region, and I talk about the Gulf.
Yep.
Collectively. Do they need to be out on? Do they need to be somewhere else and doing education? I mean, it's all about numbers. End of the day, to build a proper school that's in our region that caters for these children. They're not out. They're not being, confronted with racism because they're so far away from home. You know, we have kids that are over here in Cairns, you know, that go to school here, and they come home. They go back to Doomadgee because they're too afraid to actually confront or being allowed to talk about racism, because half of them don't even know what it means. You know, they think it's just someone picking on them. But yeah, it's sad because, you know, our children don't identify it unless they're aware of it or they know the word, you know, and that's really sad.
So ideally, you'd pull from Normanton, Burketown, Mornington and Doomadgee. So that would be your cluster.
Well, collectively, yes, because they come from that region and they're familiar with each other, you know, and families. I mean, that's, you know, education is heaps of money. Put it somewhere where it's useful, you know.
Yeah. Thank you, Barry.
Ms Cook.
Thank you. Thanks, Chair. Thank you for giving your evidence today. It's really powerful, and I'm really, really sorry about your grandson. It's just absolutely tragic.
Thank you, Ms Cook.
I know that you were involved back in 2023, I think it was. There was the inquest into the deaths of 3 women from your community, known as Kaya, Miss Sandy and Betty, who died in 2019 and 2020. You've already talked about the levels of rheumatic heart disease increasing since that inquest and the findings were handed down. My understanding that it's up 86% in your community since that time.
Yep.
At the time, different people from your community spoke about services need to be invited into community, they should be community controlled and follow cultural protocols. You've touched a little bit on how little things have changed. What do we need to do as a federal government to stop people in your community dying of preventable diseases?
Look, I think, and like I said before, it needs to be everyone working together, because at the moment, Doomadgee itself, and I can speak from experience, is fractured, because everyone comes in, end of the day it's a mighty dollar. It's not about how mighty your service is, it's about how mighty your dollar is, you know. And I've experienced it for the last 60 years, what it's like. But particularly if, and I think there was a touch on the fact of cultural awareness training is a hereditary one. You know, I also run a private, not private, but a consultant business, a traditional owner from Doomadgee. Most services will touch me with iron picket to do cultural awareness training. They'd rather get it done in Brisbane. You know, what's the difference between Brisbane and myself?
Are there any other health conditions that you can share with the committee where you see that systemic racism issue?
Yes, I see it in my age pension too. The elderly people that are living in the age pension in my community. When things go wrong with our elderly people, and I'm talking about our knowledge, our acknowledgers who acknowledge us too as well, but that we get knowledge from. They are treated very, very bad. They don't expect, I mean, all they're doing is paying rent. You know, they're renters. Nothing else. You know, there is no scope for, oh, you got a whole heap of family here. Let's get them up and celebrate whatever. Let's get them up and take them out with you. None of that happens, you know. And they're secluded, these people, you know. And I'm glad you asked that question, because I had a brother, my second eldest brother, who was put into age pension, and we didn't even know that he died. Didn't even know, because the relationship was fractured. We found he died the Sunday. We didn't find out till the Tuesday that he was put in the morgue, you know. So, you know, things like that. Murray came from a large family, my brother, 13 of us, 12 of us now, you know. I got 152 nephews. We didn't find out till Tuesday that he died Sunday.
Chair, if I could just ask one final question. We've talked during the course of the inquiry about the importance of people being able to tell their stories and share what has happened to them. You touched on it earlier where you said how much you appreciated coming today to share what's happened to you in your community. What is the importance of people being given the opportunity to share truth about their history, about their practices, about... We did have truth-telling in Queensland. It was abolished. What do you feel about that opportunity, not just today, but more broadly for people, First Nations people, to share what's happened to them?
Well, I think because we all have trauma. Trauma is another form of mental illness that gets to us. Whether we understand the word trauma or how people act, and if they don't know what it does to people, especially Indigenous people. Trauma, and and I'm glad you asked the question. I was brought up in the dormitory. So as a child of 8, I still live with trauma. I was brought up in the dormitory. Mum and Dad lived about 100 yards down the road from the dormitory. I was brought up that way. I wasn't allowed to talk to Mum and Dad walking past the fence. Otherwise I'd get a hiding. I was told I was only allowed to wear a sack bag, not shorts or shirt. That's how I went to bed. You know? So, in regards to that question, I believe that my experience and other experience that happens in these communities, and regardless, holistically around in Australia with the First Nations people, we live with that trauma. It's just how we hereditary, or how we talk about it to our children, our First Nations children, about the experience, and whether it's a good experience that we talk about or a bad experience. But it's always going to be there regardless. And around truth-telling, the last thing that anyone wants to hear is obviously my story about what happened to me in the dormitory. Hey, I'm just Aboriginal. Who gives a hell about him? But just imagine if that kind of mentality is going around in Australia about us. It's bad, you know? And particularly for that, I think truth-telling was probably going to be the pinnacle, but obviously because of the government, the old mate down at Brisbane there, old Premier, you know, he didn't think it was a great idea. Well, you know what? Good luck to him the next election. You know?
Thank you.
Sure.
Because it's not Queen's land, as we know. It's certainly not her land. It belongs to us. It always has and always will be. But given we've got the rise of a very racist political party that's come out of this part of the world, has racism got worse as a result of the racist party's rise?
Well, Senator, I believe it's gotten to the fact that the financial backing which these people have allow them to have these kind of powers to do this. You know, racism has gotten worse it's not even addressed at the moment. We don't have that fully addressed about racism. Racism grows each day, whether it happens here today, whether it happens next week, next year. Racism is a form of, it's a form of fig or slime or something that grows on trees, you know. But this you can't get rid of, because you get reminded of it every time you meet someone that is racist, you know. And just for that, you know, it's really hard, because you think about you think about how many of our Indigenous people that are incarcerated, very high rates. And the only reason why I say that is because the fact I'm a really big part of the justice group in Doomadgee. We've set up an organisation through the Attorney General around dealing with justice, and there's a justice group committee that we have, and the high rates of people that go to court in my community are so high, cars have to give away to them when they drive into my community, front door. They got to give away to them to go across to the courthouse. That's how large racism is. You know, is that large our children go to court. You know, they don't even understand the word justice, half of them, but they go to court anyway, you know. And the justice system fails, and it grows bigger because the systems that they have in place. A legal system that has no understanding about our cultural backgrounds, our cultural ethics, and our understanding of how we survive through our culture. We don't survive through any other thing. We are guided by our cultural instincts, you know? And if we're not guided by that, then you may as well go and live somewhere else, you know? But yeah.
Thank you.
Thank you. That concludes the time that we've got this morning, and on behalf of the committee, our sincere condolences. You'll be sent a copy of the transcript of your evidence from today and have an opportunity, if when reading through it you see any errors that are there, you can request corrections to any errors that you find. And if there's any additional information that you want to provide to the committee after today, if you can please forward that to the Secretary by the 19th of August. Mr G is indicating he's got one very quick question.
Okay.
Mr Walden, your grandson's name, what was his name?
Shaquan
Walden.
Thank you.
Thank you very much. We'll now take a very brief suspension while we welcome our next witnesses. hot here? Or?
Yeah, it's a little warm.
We will now resume. I call on Michelle De Chong to give evidence for the Hansard record. De Chong to give record. For the record, can you please state your full name and the capacity in which you appear?
My name is Michelle De Chong, and I am appearing wearing kind of two hats. One is the previous chair of the Queensland Treaty Institute, and secondly as a resident of North Queensland and a business owner.
Thank you very much. Although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as a contempt of Parliament. The evidence given today will be recorded by Hansard and attracts parliamentary privilege and is being broadcast live on the Parliament's website. You can see from the nameplates who we've got in the room with us today, and I don't think we've got anybody joining us online right now. I'll now hand over to you for an opening statement.
Thank you very much. I want to firstly acknowledge the short notice by which the committee has allowed me to appear today. Just fortuitous that I happen to be in the same place. I was unable to put in a formal submission, so again appreciate the opportunity to just provide some perspective as a follow-up probably to your Brisbane conversation and what happened in Queensland in terms of the Path to Treaty Act. So one of the things I wanted to talk a little bit about and just provide some context of the differentiation between the Truth-Telling Inquiry and the Treaty Institute. They were both elements of the Path to Treaty Act. However, the Truth-Telling Inquiry was attached to the department, whereas the Treaty Institute was tasked with creating a new independent authority. I do want to acknowledge all of the work that went in the interim treaty body, the consultations, the sort of 10 years in the lead up to the actual passing of the Path to Treaty Act. And it was enacted on in April 2024, at which point the Treaty Institute was able to then appoint council members and begin the process of building an independent institute for Queensland. I was appointed to that council and then ultimately appointed as the chair. And one of the things I wanted to just speak to today is really the impact and the process leading up to the abolishment of the Treaty Institute. In particular, it was a very short period of time, obviously April leading up to an election later in that year. We always knew that the timing was against us in terms of getting specific runs on the board. However, we did begin all of the processes that we needed to in terms of setting up the administrative function of the Institute and considering location, intent and what the treaty consultations would look like across the region. We knew that as a result of the referendum, the Queensland government had made some statements about what they would do when and if they were elected, and one of those was the abolishment of the treaty. When the government was appointed, though, it did talk about its first 100 days, and at no point in those first 100 days was the issue of the abolishment of the Institute noted in those 100 days. On the first sitting post their election, there was the Repeal Act, which was entered into the Parliament. I do want to acknowledge, I'll speak about Josh Creamer here as well as the other person leading the work of the Truth-Telling Inquiry. Josh and I both received an email on the morning of a day in Parliament that instructed us that this Repeal Act had just been introduced to the floor, and that they would be meeting until midnight to ensure that that was passed. Ultimately, I guess, dropping the hammer on us that day without any particular notice or insight as to what that would look like. So as a result, the government also made some statements around people not losing their jobs, you know, those sorts of things in terms of when they took office. But ultimately, that the repealing of that act also affected 4 staff members that were working for the Treaty Institute at that time, all very shocked and distressed as to the way in which it was handled, but also the questions that they had about what that looked like in terms of the work that they had contributed to, but what that would mean for them in the future.
Chair, just at this point in time, can I just disclose, just for the benefit of the committee and for the record, this witness obviously wasn't on our list today, but has just mentioned Joshua Creamer, who is my husband. Yep. So just for the benefit, I don't think there's a conflict if I don't ask any questions. If I'm present in the room, I think that's okay. Yep. But just for the record, I think that's...
Appreciate that. Thank you, Ms Cook. We'll go to questions and begin with Senator Thorpe.
Thank you, Chair. Thank you, Mr De Jong, for appearing and providing, you know, some context to what happened when this racist government came to power. What is the plan now? Like, what harm has that done? What was the feeling leading up to that for our people here? You know, some kind of, you know, light at the end of the tunnel, were people excited? And where to from here?
Absolutely. Thank you for your question. I think that the passing of the Path to Treaty Act was a beacon of light for Indigenous people in Queensland. You know, that it had been in progress for a long period of time. It was really the moment where we had started to see some traction, moving from a discussion point to action, and recognising, you know, that there were a lot of communities that had already started to think about the way that they would make a contribution to the truth-telling inquiry, but also what does this look like to negotiate treaties on our terms within the state. And so, you know, that kind of positive energy really was seen throughout Queensland, and people were very eager to get the process started. Again, I won't speak on behalf of the Treaty Institute, the Truth-Telling Inquiry, other than to say, you know, they did a lot of groundwork, set the foundations ready to do community consultations, and unfortunately I don't think that they really got even one on the board as a result of the kind of political environment that was being imposed. I think the other thing that happened for communities as we started to kind of think about that process and following some of the lead, obviously, in terms of what was happening in Victoria and how we might collaborate and share insights on what works and how those frameworks can support but not duplicate what was required in Queensland. One of the things that was quite interesting in terms of the abolition of the Treaty Institute, and I wrote to the Minister at the time saying, is there an assurance that the money will continue to be invested in Indigenous people, so to not sideline that funding? But ultimately the government wrote to us and said that the priorities will be housing, job creation, and education, I think was the other one. So for me, it was also a diminishing of all of the work that Indigenous people have done in terms of advocating for the depth and breadth of issues that are impacting our communities. And so further to your question, I think that people have been in a little bit of a shocked state in some ways post the treaty situation. you know, in many ways retreating and taking stock of where we're at and what next. I do think that there's still some very positive conversations happening across the state, but I would say that a lot of those things are happening by stealth, because we have to be careful about the language we use, what we attract in this current political environment. Further to that, I think the other thing that I have noticed, certainly both from the work I do, but also just as people have spoken, I'm sure, in Brisbane, the conversation around project invisibility. It is very real, and I'm glad that we got to a point where we brought it out into the open, that racism has just escalated, particularly in some of these regions. So like North Queensland, far North Queensland, I live in Townsville, and we have seen overt racism in a way that I don't think we've seen for 20 years. And part of that has been because of a lot of the, almost the permission to use the no result as a blanket response to everything to do with Indigenous peoples, Indigenous policy and inclusion. So while we fulfilled a democratic process and went through a referendum as we were required to do so, the result of that has actually been far more widespread. It's impacted funding, it's erased roles of advocacy and representation, and pretty much anything that's on the table for Indigenous people is fraught with, didn't we vote this down? As we all know, you stay out of the comments as much as you can on socials, but it's not even just in those spaces, it's actually out in public and in spaces where you just try and enjoy a meal, but you can feel that the energy has changed in terms of those spaces.
I know I said one question, but can I have
one more?
Two? Because, you know, there's so many uneducated, ignorant people out there that have become so racist. They're frightened of the word treaty. So what is treaty for you? And what was treaty for your mob here? And what's there to be afraid of?
Well, I think, again, thank you for the question. I think that the reality of the word treaty means something very different to even amongst Indigenous people versus what it means to others. But ultimately, what we were pursuing is a conversation that makes up for the 200 years of absence in terms of Indigenous rights, recognition, provisions to make decisions on our own terms, our self-governance models, the way in which we speak for and represent country. And in negotiating treaties, also recognising that I guess the environment that we have been working in is one that has been imposed on us, and treaty provides an opportunity to come to the table to renegotiate those terms. And for some people, and rightly so, Indigenous people say that we don't want a treaty with the state, and that's a valid situation. However, one of the challenges I think we have in Australia is particularly in relation to economic capability, and Indigenous people do not generate economic wealth from their lands and have never been afforded that right to be able to create their own economic viability, and hence we've always relied in some ways on the state to provide support for the work that we need to do in our communities. So I think treaty was also a pursuit of self-determination through self-governance, which also creates self-provision for economic viability and future.
Thank you.
Thank you, Senator Thorpe. And just noting time, I might put my questions on notice to you, but I'll indicate what they are in the first instance. One is, I suppose, giving you an opportunity to, on notice, provide a more kind of detailed or substantive information in terms of the experience here in Queensland with the repealing of the treaty process, the truth-telling process here, what the fallout of that has been for mob. And I appreciate that you've responded to Senator Thorpe on these questions, but you might want to have a bit more time to think about, and put that in writing to the committee for us to consider. And then the second question for me is, we haven't had a lot of evidence as a committee about the impact of racism for First Nations businesses, what that lockout of our economy has meant for First Nations people in terms of our ability to be financially independent, all those types of things. You talked about the inability to create wealth off land for our communities, which is absolutely one part of it. The other part of it is, we were locked out of the economy until 50 years ago. Arguably, we still are being locked out. So would be, from your personal experience as a business owner, would be really interested in your experience of racism, the things that you see when you're engaging with other people or online, and or if you've got experiences from other businesses too that you want to contribute to this inquiry, I would be really grateful.
If I may just take a few minutes to respond, because the business stuff was actually, I do work from a national position on that, and one of the things that's interesting, and I kind of want to acknowledge the growth of the Indigenous business sector, but at the same time, one of the consequences I think that we are seeing, both because of reconciliation action plans, but also some of this conversation around what's acceptable and what the people still want to give time to. There has been evidence where Indigenous businesses have been afforded contracts under the procurement policy or other agreements, and post-referendum we've seen those opportunities being taken away. So I feel like it's kind of that now there's a window to opt out. And I say reconciliation action plans as well, while they have provided a really important pathway, in some ways that's also not on the table anymore. And if I may, there was just one other matter that came up from the previous witness, who I just wanted to put on notice for the committee, is in relation to, we were talking about discrimination and in particular systemic issues. One of those issues is superannuation and the access to superannuation for Indigenous peoples. Many years ago there was a report done in relation to Indigenous women and access or lack of access to superannuation. We know that through the years of CDEP, contributions for superannuation were not apparent for Indigenous people, and now I understand at a federal level there's also a conversation around increasing the age for age pension and access, and that obviously in comparison to life expectancy and the economic impacts of that, I think would be useful for the committee to consider.
Thank you very much. Appreciate that. That concludes the time we have for a very, very brief but important contribution this afternoon. I look forward to the responses on notice to the committee, which of course are due by the 19th of August. And if there's any issues in meeting that time frame, you can have a conversation with the Secretariat. I'm sure that'll be okay. And you'll be sent a copy of the transcript of your evidence today. And if when reading through it you see there's any errors there, you're welcome to request corrections to the transcriptions as well. Thank you very much. We will now suspend for lunch and return at 1:40. I now call on representatives from the Torres Cape Indigenous Council Alliance to give evidence. For the Hansard record, would you please state your full name and the capacity in which you appear before the committee?
Hi, I'm Lucy Dino. I'm the Senior Executive Officer for Torres Cape Indigenous Council Alliance.
Thank you. I've got a little spiel to read and then I'll let you know who's in the room with us. Although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as a contempt of Parliament. The evidence given today will be recorded by Hansard and attracts parliamentary privilege and is being broadcast live on the Parliament's website. Joining me in the room today, we have Senator Thorpe, Mr Smith, Ms Cook and Mr G, and myself, your chair, Senator Stewart. Thank you for appearing a little bit later on the program than you were scheduled. Appreciate your patience with us, and I'll now invite you to make an opening statement.
Thank you, Chair, and the members of the committee for the opportunity to appear today. Can I just check that I'm coming through okay?
Yep, we can hear you okay.
Thank you. I'm dialing in today from Goodyamathy country up here in Cooktown, and I want to acknowledge the traditional owners of the land and pay my respects to my old people and to Aboriginal and Torres Strait Islander people in the room and online. So my name's Lucy. I'm appearing today on behalf of TICA, Torres Cape Indigenous Council Alliance. TICA is an alliance of 16 remote local governments, 14 of which are Indigenous councils, and those councils represent communities across Cape York, the Torres Strait and the Gulf of Carpentaria. Our members are democratically elected mayors and councillors under the Local Government Act here in Queensland. So they're responsible for governing some of Australia's most remote communities and delivering essential local government services in those areas. TICA didn't lodge a formal written submission. Instead, we met with our members to discuss the inquiry and to gather and confirm the collective perspectives. I also want to acknowledge that one of our members, Northern Peninsula Area Regional Council's submission, and how we want to support that, particularly in relation to the issues raised around systemic racism, housing, infrastructure and institutional decision making. The key message I think that TICA really hopes to leave with the committee today is that from the perspective of Indigenous local governments, racism is not only experienced through individual acts or online abuse. Our members consistently see racism reflected through historical policy settings. It's through funding models, it's through administrative systems and the decision-making processes that continue to give inequitable outcomes for our people. And most of these are without any review of the historical context of how these systems came to be. So I think with that, I would welcome any questions from the committee.
Thank you very much. And I might begin with Senator Thorpe.
Thank you for appearing today. How prevalent is racism in your councils and what are the key drivers?
Thank you, Senator Thorpe. Do you mean within our councils as employees or as members of the community?
Wherever it might be.
I think thank you for your question. I think with councils as the major employer within our communities, we find that we know that the employment rate within our communities is quite low, whereas our local governments are the major employers in some of our communities. So we do know that there are issues with wanting to be employed because of issues of racism. Those are things that continue to need to be explored, and that's part of, I think, what we're trying to raise around the governance systems of local governments. How do we really enact what is the word, taking that authority in controlling our own councils and how they're run?
Thank you. Are you able to truly self-determine our own solutions, our own destiny, or are you bound by local government rules?
Local government councils, specifically for First Nations councils in Queensland, when they moved out of there was an old framework where there were Aboriginal councils and island community councils. That framework changed and they were put into the Mainstream Local Government Act. And so when we talk about self-determination, there hasn't been a review as to how we actually manoeuvre within that act to do those things appropriately. That's for our culture and our people, and actually acknowledges the history that we've been through, particularly in local governments up in Queensland, where those boundaries are set from historical context. So we haven't gone back and addressed them. So I would say self-determination is a difficult thing to do with the system that has been applied around us.
So in terms of meeting the people's needs, if we're bound by the colonisers' rules and can't self-determine our own destiny, what does that look like if we can't do that? What are the effects to not being able to be in control of our own destiny through self-determination?
I think what we see playing out in communities is a high service level because of our reliance on social funding and then services from the state and federal government. And so when we're looking at influencing policy decisions and how some of these programs are lined up, we really need to go back to the drawing board. So in terms of meeting people's needs, I think the local government really want a seat at the table. The local government members are democratically elected people, which means that they're in their community, they understand their genuine needs, but they're not finding themselves at the table when these programs and policies are put in place in our communities.
Thank you. Climate change obviously affects our people more than anyone else in this country. How does it disproportionately impact people here and, well, in the Torres Cape?
Climate change, I think, is a very broad issue. I know that I'm certain when the public hearing travels to Thursday Island, there will be some examples provided by people on the ground up there. I know from a thicker perspective, it's something that we want to continually raise. Again, it's getting that seat at the table to making sure that our members in the Torres Strait Islands and in those really remote areas do have the opportunity to make a statement about the policies that are in place. At the moment, meetings are held in Cairns and in Brisbane that are way away from where the actual people on the ground are. So we would like to see like a change in investment around actually putting those people with the knowledge on the ground and upskilling them and building capacity so that the people out in those remote areas are actually driving the policies. With things like climate change, it really comes down to people who are there all the time through the seasons. And so where we see officers who are travelling from other areas and coming and doing this and delivering those services and maybe reporting back, there's a lack there of understanding genuinely how much that impacts our communities.
So if you don't have a seat at the table, is that systemic racism?
I would certainly say that the systems that are placed around, especially in Queensland, have been built on racist systems. We could look at, from a local government perspective, the boundaries of our First Nations communities align and share a boundary with Cookshire Council. Cookshire Council is also a member of TICA, and it is the largest geographical council in Queensland. But it almost mirrors the resource boundaries from when the gold was discovered back in Queensland's early history. So we still have where the Aboriginal people were moved out into the missions and reserves, where they sort of nurse the coastline of Queensland. That is the boundary that's historical, and so there isn't. We do need to determine how to get a seat at the table that is actually equal and fair and really takes into consideration what the people that live there day to day actually go through and how they can contribute to what happens on the ground.
So what's your message to the federal government to act on supporting self-determination particularly and ensuring that our people are not only equipped to confront and deal with climate change, but given there's a lot of racism when there is a natural, or not natural, it's all colonisers' disaster that they brought here. We know that people, when they go to shelters or emergency shelters, that they experience racism as soon as they rock up, so they don't go there because they're not welcome. So what is your message to the federal government, or what do you want from the federal government, given we're all federal politicians here today?
With relation to disaster, what we've seen in Queensland is the police take a more formal role in that disaster preparedness, where it used to be a different department. So when we talk about people having a fear or some trauma from wanting to enter and deal with institutions, that presents some difficulty when we're talking about disasters, because we are all in the same situation, we know, in these remote communities. When we're talking about shelters in some of our remote communities, even the, I suppose, the capacity around ensuring that our shelters are managed and maintained into the future. We have had funding for emergency shelters in some of our communities, but we saw with the most recent disaster, which was a weather event earlier this year, that some of our shelters weren't able to be used. So where we saw Narelle come through, there wasn't a shelter available for people in Lookout, Cowan or Hopevale. So there's two things about whether or not people would even travel into the bigger towns like Cooktown to access the shelter, or whether they feel more comfortable staying in their community, but we're not able to provide those things. And again, going back to, I think, having a seat at the table to make sure that we have some accountability for things that are raised. I'm not saying that there's not an opportunity to raise these things as an issue, but also making sure that we're keeping the government accountable to following up on these statements, looking for action, finding ways to strategically make comments and statements about how we'd like to see things change in our region, and making sure that message lands with the right people.
Okay, thank you. I'm happy to pass. I've got a lot of questions, but I will put the rest on notice for the interest of time.
Thank you, Senator Thorpe. Ms Cook.
Thank you, Ms Deemel. I had some questions about, I guess, we've got the Local Government Association in Queensland. TICA, I assume, has what's your relationship with them and the sort of advocacy they've been doing federally for local governments in Queensland?
The Local Government Association of Queensland represents all of the local governments within Queensland, so all of my members are also members of the Local Government Association of Queensland. And then they are the members of the Australian Local Government Association, which then represents nationally all of the councils and mayors. So we operate as a separate body, as a regional organisation of council. We see our peers as other regional organisations of councils, which are groups that the mayors have coordinated together to establish, either through shared boundary or shared need. So we have peers sort of out west that are called the Northwest Regional Organisation of Councils, the Northern Regional Organisation of Councils. We sit in a different tier where we're guided by the members and we use their resources directly for them to drive what our directions are. So we are sort of in line, but we do work separately, and that's why with the LGAQ's current, I suppose, campaign, we've seen our members certainly lend their voices to it because it is in line with what their needs are in the community. But TICA will also work to make sure that TICA's statements around anything that needs to change is really particular on Aboriginal and Torres Strait Islander need and First Nations community and remote communities.
And what have your members of the Alliance told you about their experiences of racism from a local government perspective? Have they indicated to you if that has changed over time? Has it gotten better or worse?
It's within the local government's realm. There have been changes of local laws within some of our peers within other councils, where we've seen changes to central business districts, and they've been allocated special precinct laws around designated central business districts, and that's increased police powers within central business districts, which has had a disproportionate effect on Aboriginal and Torres Strait Islander people. So where we see that in places like Cairns and Townsville, those people who are there and can be considered a transient part of our community are there partially due to changes in our health system and the works of our patient travel system in Torres Cape and Hospital and Health. So there are things that link back to changes that are made by local government and council laws and mayors in areas that we see could have a racist connotation.
And so this committee, obviously sitting at a federal level, the federal government is responsible for some of that funding that comes through the associations for local governments. Do you see any racism in how that funding is applied?
We have asked questions of the Local Government Association of Queensland around how they can support the Aboriginal and Torres Strait Islander programs that they are funded to support. We would like to see certainly more Aboriginal and Torres Strait Islander people employed. At this current stage, we understand there are none. And we do also know that the LGAQ, the state government have signed the Indigenous Leaders Accord, which is an agreement at the state government to work with the 17 First Nations Councils mayors to work on priority issues for Aboriginal and Torres Strait Islander people. The LGAQ were a signatory to that document, and so that we think that there is an importance in making sure that Aboriginal and Torres Strait Islander people are also involved in the process of enacting and coordinating that whole accord process.
And so what would your recommendations be for this committee in terms of advocating for your members to reduce racism in their communities?
I think we would like to see if there's funding applied and it is directly related to programs that are impacting Aboriginal and Torres Strait Islander people. We certainly think that at a broad level, further education would increase the empathy, understanding of the impact of historical policies around Aboriginal and Torres Strait Islander people, and also understand how programs and why programs are needed currently. I think more information, and if the government believes that the tone is from the top, if we can guide the direction of the board members through funding agreements that make sure that they are taking it seriously, not having a rap just for the sake of having a rap, but actually enacting things and making sure those programs actually represent the community that they represent. We would like to see, I think, more transparency also around the funding to ensure that people in the community really understand that if it is another organisation that doesn't necessarily look like an Aboriginal and Torres Strait Islander organisation, but they've been funded directly to support their community, that they're clear about that and what their outcomes are that they're trying to achieve while being in our communities.
When you say further education, do you mean for the broader community in terms of, for example, truth-telling processes, or do you mean training and education for people making those decisions? Or, I mean, it could also be both or something else.
Certainly, I think it's a mixture of both. We have seen that obviously in Queensland, the funding for truth-telling was removed and put towards different programs. And so we've also seen within some of our state government bodies like the library, the archives, not as many resources around Aboriginal and Torres Strait Islander learning. So we want to, I think from a perspective though, if governments believe that it is toned down, then we also need to have ensure that senior delegates and people who are making decisions in government do understand the history and impact. So going back to truth-telling, at least ensuring that they have an understanding of the genuine impacts of the Protection Act, what our history around missions and stations around in our region before or while they're making decisions about our communities. There is there appears to be a distinct lack of that.
Thank you.
Oh, yes, thank you. Okay. So that concludes the questions that the committee has for you this afternoon. You've had indication from committee members that there'll be questions on notice to you. So if you could please respond to those questions on notice by the 19th of August, the committee would be grateful. You'll also be sent a copy of the transcript of your evidence from today. And if, when you're taking a look through that, you see that there are any errors on there, you're very welcome to request any of those errors be corrected. So thank you very much for your time this afternoon. We'll take a very short suspension while we welcome our next witnesses. my notes. Thank you. I now call on Ms. Nicole Huxley to give evidence. For the Hansard record, would you please state your full name and the capacity in which you appear before the committee?
My name's Nicole June Huxley. I'm a Aboriginal woman and I'm here as an individual.
Thank you very much for that. I've got a little spiel I'm going to read out and then I'll invite you to make an opening statement. Although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as contempt of Parliament. The evidence given today will be recorded by Hansard and attracts parliamentary privilege and is being broadcast live on the Parliament's website. You can see from the nameplates in front of us today which committee members are joining you. I now invite you to make a brief opening statement.
First of all, I'd acknowledge the lands that we're actually meeting here on today. I'd also like to acknowledge the two elders that I have praying with me, Auntie Phyllis Grant and Uncle Abe Marita, Jirabal, Giramay, and I'm a Aboriginal woman. Well, I'm nervous.
Take your time. Take your time.
The thing is that I'm going to open this statement just to remind the panel, the committee and those present is that I'm actually a very proud Aboriginal woman. I was born an Aboriginal woman and I'll die an Aboriginal woman. I'm the descendant of Black Boy Jerry and Topsy Hound. I am why I fight. I am who I am today because of them. And I fight every day for change for our people. Black Boy Jerry helped open the whole of far north Queensland under the government expedited expedition in 1872. I brought with me documents that are written by their words, and this is what stands between me and their time of 1872. I was born 100 years later in 1972. I was a child of the state. I was a child that lived in the bush with my family. Our family were asked to show proof why our people needed housing. They needed proof, so they came and took photos of my family living in the bush. We were fringe dwellers. I'm traditionally from Charters Towers. That's my Aboriginal country. My great-great-grandfather is a Giramay man, removed from his people. My great-great-grandmother was removed from her people as a 7-year-old child. She ran away with another little girl named Katie. She ran away to Big Sandy. Big Sandy today is named after the Hand people. To teach her a lesson to not run away again, they shot her whole people. They shot them in the creek bed. So I am those old people today. And every ounce of my being and my spirit has been about fighting for the rights and the justice of my people on all levels, whether it's me as an individual, whether it's for me and my children. I'm a mother of 10. Whether it's for my ancestors that actually fought before me. The thing is that I've been around. I've lived and worked in remote communities where English is their third language. I've seen the poverty. I've seen the dispossession from governments, lateral violence that comes through policy. I am now representing a community of Jumbun where we just recently experienced racism. Not once, we've experienced a few times. And I'm also the manager of a housing organisation that's been around for over 50 years. That still, since ATSIA closed their doors, has had no government funding for their housing repairs and maintenance. I fight the Indigenous Land and Sea Corporation on a daily basis because they cannot retain their staff for my community that they own since ATSIA closed their doors. So as an Aboriginal woman, and I'm a very proud Aboriginal woman, I'm very staunch and I'm very strong, But I sit here today and I will proudly and honestly speak open, speak truth, and the only way I know how to is from my spirit and my heart. Thank you.
Thank you very much for that opening statement. Go to questions, and I might begin with Ms Cook.
Thank you. Thank you, Ms Huxley, for coming today and for that really powerful opening statement. It means a lot to us that you're here to give your evidence. We are all federal members of Parliament. We're looking at racism, and in your submission you talk about the racism that you have seen, particularly in housing and in housing administration. Can you talk to us about that?
I can speak to you on different levels. The first one is entering the community of Jumbun that's been under the ownership of the Indigenous Land and Sea Corporation, where $2.3 million was wasted because of contractors coming into our community thinking just because we're black we wouldn't care, to fighting 4.5 years later for ILSC to take responsibility of that on behalf of my people and my community. 4.5 years waiting for it to be fixed up, to being called home again to help with Jupiter Mossman housing. 26 years of no government funding, walking into a housing co-op where they jump through all the hoops for nurse registration to be able to get government funding, but again still get zero from government. Applying for funding in these areas and being told that you have to be build ready. How does the government expect First Nations community housing organisations in this state especially to be build ready when all we survive on is rental income? The government has a lot to answer for in regards to the housing of our people in this country. We as Aboriginal people have had 256 years, maybe 254, let's do the counts, compared to the non-Indigenous people of these lands, to be able to structure a houses that are suitable for our people and our communities. I actually sit on the Aboriginal and Torres Strait Islander Housing Queensland board now, just to be able to have a voice at that level, which I have been doing for a very long time, and going, where can I sit at these levels to be able to be heard? I may not speak the government language, but I speak from my heart, and I speak from experience, and I speak for my people. And with Jumbun's housing at the moment, yes, we're getting it addressed. But if you look at myself and you look at Auntie Phyllis and you look at Uncle Abe, we're tired. Because for 26 years, the ILSC has had this community. I had to stand up in front of 400 to 500 people in Western Australia in Perth at the ATSIA summit and question Joe and say to him, have you ever, or your board ever put foot in my community? No, they never. But they can sit back and make judgment on a community that they've never ever went and visited and seen with their own eyes. So he turned up, I invited him to come, and he was asking questions of how long things were laying around for, infrastructure that was just sitting there and wasting money. I said, I don't know, ask your staff. I said, because it's been there the whole time I've been there. The housing issues that we have is not about Band-Aid solutions. The housing issues are about working with our people about what kind of homes we need. It's sustainable homes. It's a voice that we need to, we need to be heard around housing. Homelessness is what we drive as well. We've got overcrowding in our homes. Jupiter Mossman runs a homeless service, but we don't have enough homes. So what are we supposed to do as a community organisation? I think what a lot of government people don't realise is that as Aboriginal people, we run our organisations for a service, but we do more than that. We're there as shoulders for our people to cry on. We're there with ears to listen to their problems. We go far beyond what a government grant can provide to ensure that our people are being heard and felt, and that we can be able to address the needs of our communities.
Thank you. Your submission also talked about online racism particularly after the voice referendum. Can you talk to us about the impact of that racism on your community?
Our little community of Jumbin is a quiet community. We're not political. We don't go out screaming on a daily basis. But I can speak on the issues that have come out of the online stuff that we see on a daily basis. I try not to be political when I get onto these things and try to actually put a platform about why we as Aboriginal people are continually suffering. But then the racism comes back and says, we've given you enough. So I look at our communities and goes, what is enough? I have invited Jacinta Price and others to come and speak with me. Come to my communities. Come and hear our stories. These are the platforms that our young people are reading on a daily basis. I don't want my children to see that. I don't want my grandchildren to see that. This is supposed to be a human thing. Racism isn't human. And if we're going to make a difference on these platforms, it's time that people like myself call them out, which I've been doing. I hear my mob, my families, we sit down and we talk, like we had a little discussion one time, and not long ago actually, and my brother reckoned, come on Nick, let's call them out. Well, we do it together, brother. Yep, let's do it. But the thing is the racism just kept coming and coming. We can't keep fighting it because we're tired too, because we live it and breathe it every day of our life. Our little community in Jumbin just sits back and they're very quiet. They don't go out of their way to harm anybody. But for one thing that happened, for example, and it's a bit before that is that we had COVID, and I asked the government to close the road down to the Murray Falls to stop tourists from coming into our community. One of the locals said the road down the road was named after her grandfather, and the only reason that we want the falls closed is because there's now money involved. I said, no, that's not it. I was very professional in the way I responded, because I was responding on behalf of my community, is that we were there to protect our elders, and we don't have many left in our community. We couldn't allow visitors to come into our community, especially dealing with 40 live cases in our community. You know, and it's so, sorry, it's just frustrating. It's so hard.
We heard evidence from Meta earlier in the week, and they say, well, we have policies and procedures and we remove some things off online, and, you know, we expect people to, do you think they're doing enough?
No, they're not. And the thing is, you've got probably Townsville Bulletin and stuff like that, that they cut off comments. But there's certain things that they don't turn the comments on, off on. Why? Are they trying to build this platform even more? I just recently had one with Prospect in Charters Towers, where the racism that came in about our children dancing on the road in the street for our NAIDOC celebrations, it was so sad and disgusting. I had to respond to Prospect and say, do you allow this to happen on your social media? And it took them till the next day to actually block it and turn it off. You know, how can they pick on our children? No matter what colour we are, children are innocent in all of this. But these people seem to come out and just pick on our kids for what? Practising their culture and being proud of it.
And just last question from me for you today. What would you like to see as an outcome of this inquiry?
Truth. Truth about how we have been affected. It's that intergenerational pain that we suffer. Truth from government to be able to sit down with our people and work with us hand in hand. Nothing can be driven without us. To give us the ownership that we deserve. We're not dumb when we're not stupid. The government continues to come into our communities through policies. Policies driven by who? Not by us. If they, you know, the local decision-making body stuff, you know, I thought, no, I'm going to put my hand up, and I applied for the JCC. It was a waste of my time and energy. No one really wanted to listen to my truth. So government needs to start looking at how they deliver programs to our communities. There's not going to be a change until I think that they accept that the truth is that the only way that we can make a change, the closing the gap stuff is a whole lot of shit. Sorry. Because we're not closing the gap. I want the gap gone. I've said this many times because it's not being driven by us. We developed a program called Gumbara in our Mulla. Gumbara is cyclone. Mulla is in our hand. Cyclone is like government. It's forever impactful, sometimes on a, large impact, medium impact, small impact. It's still impactful on our people unless it's in our hands to take control. We are an industry in this country. And until that industry is taken over by us, we'll continue to be dictated by government and driven by government policies. We sit in our communities today and go, okay, here's a new policy. How high do they want us to jump this time? What do they want us to achieve for them this time, and how long is it going to last? The government has to change the way that they work with our people. They have to start listening to us. I go out of my way fighting with government around their policies. I'll use some good examples. There's funding programs, for example, that we can apply for, but hold on. The first thing is you've got to be ticked off to be this, registered under this. And I'm going, well, hold on. It made me cry this day because I thought this was our opportunity as to opening a door for an economic opportunity for our community. We're 100% Aboriginal owned and operated organisation and community, and we're still not eligible. But it's because you've got to tick certain boxes. That has to change. It should not be about how we are registered. It should be about how much we are actually owned by our people and operated by our people and managed by our people. And the visions are driven by our people. The aspirations come from our people. So government needs to start listening. What I hope from this is that everyone's voice is heard, and that it's just not another document that's going to be written sitting on a shelf collecting dust, because that's all we're used to. We are used to money being wasted in our communities, and I can tell you, I've been Mornington Island, I've been Doomadgee, I've been El Perulam, I've been Warrabinda, Cherbourg, Brisbane. I lived and worked in Brisbane. I've been up to the Cape. I've been all around this state, and I tell you now, there isn't much difference about how programs get delivered through government. The only difference is that we're all not the same. The needs may be, but it's how you deliver it isn't. And I think that's what the government needs to also understand.
Thank you. Thank you, Chair.
Thank you. Senator Thorpe.
Thank you, Chair. Thank you for your opening statement and your staunchness and your continued fight for your people, your land, your water, your air. ATSIA had its problems, but it was grassroots. It was self-determined. It was put there by the people for the people. It's been replaced by the National Indigenous Australians Agency, the Indigenous Land and Sea Corporation, and the Minister for Indigenous Australians. Self-determination is a buzzword that government use to make us feel better. But what you're saying is that's not what is happening on the ground with your mob or my mob or any mob that I see that I've been talking to around the country. So given NIA, ILSC, you know, they're agents for the government, they're agents for the coloniser. How do we take that back? What's your message to the Minister for Indigenous Australians who runs these colonisers' entities that control your life, my life, our people's life? What do we do about those departments that are controlling our lives? And what does your mob want from the federal government to make that happen?
Lydia, I was actually an ATSIA councillor for 3 years. I was, I think at the time, probably one of the most youngest ATSIA councillors around. I think I was around 21, 22. And my first experience in black politics, honestly. And I come from being a child of the state to being a young mum at 15, to put my foot in the cauldron of politics around our people. I did not see that there was a real problem with ATSIC. I found it deliverable in the sense that it was addressing the community's needs and what they needed done and how they needed it done and delivered. And the only thing that I found with ATSIC at the time was certain individuals having power and control to go onto their head. That was it. What I see today with the NIAA, and I fight with them on a daily basis, is that their policy direction does not sit in our needs, the way that we see it should be delivered. If I had to say to the government, to the minister, we need another program like ATSIC, it's like the CDEP program. I'll use it as a good example. The CDEP program, our people have been working for over 40 years for their own dole money, right? But that program did not fail the people. It's the people that were running it that failed the people. I was one that used to run those programs for nearly 20 years throughout communities. It's a good example, the same as ATSIC. It comes down to who's running it and how it is structured for outcomes. I think the biggest answer here around Indigenous programs for Aboriginal people, I cannot speak for Torres Strait Islanders because I'm not a Torres Strait Islander, but for Aboriginal people is that there needs to be a major review because there's so much wastage of funding, and I can share a few examples, but the funding is not hitting the ground at all. We're not seeing it. Before it gets to us, the many agencies that it has to fund first is what I have seen. It goes to these agencies to pay what? Pay their wages, pay their operational costs. So they talk about the billions of dollars that are spent on Indigenous affairs in this country. That's not truth. Not if they came to the communities and asked us how much we really got. So the programs have to change.
So are these agencies in fact robbing us of our self-determining right, our birthright to country? Are they taking that away by being agents for the state? And on top of that, we know that the AFL and the NRL and the Northern Territory cops do very well out of the NIA budget. So are they taking our self-determination and mainstreaming it and assimilating us into that other coloniser system?
Lydia, I don't want people thinking that you're putting words. I don't want people thinking that you're putting words in my mouth because of the way that you're actually structuring that. I will stand here today and I'll stand proud to the fact that there's that much government funding gone to waste. It's not driving us to our own self-sustainability, our own autonomy. I've lived and worked in communities where the alcohol management plans came in, where they actually threatened for the, changing the way that the councils are structured and around their economy that they were running. And they came into these communities dangling a carrot. You remove that, we'll give you this. It's the nurse program. You do this and we'll give you this. It's like as though that we as Aboriginal people, to actually get funding, we have to actually agree to the dangling of the carrot. And I'm not going to apologise for what I'm about to say. I always say to people, we've got to give government what they want and take them fucking nowhere. You know why? It's so that we can address our needs. Government's programs are delivered on their own policy. their own way of doing business, their own agenda. And when it comes to the communities wanting these programs, it's not the bigger picture. It's only pieces of the cake. It's not the icing on top. The icing on top is our communities wanting and needing to be self-sustainable. We don't want to be drip-fed. We want to be in our own rights as either individuals or as communities, to be able to have our own economic base, that we don't have to rely on government funding. The government in this country really believes that we need them. We don't need them. But they have to invest in us. And I say to government all the time, why is it always one government agency's responsibility? Why isn't it all your responsibilities? Why aren't you co-investing into these programs or our communities? Housing is not just a housing issue. Education is just not an education issue. So these agencies that believe that their only core responsibility, and this is why a lot of money gets wasted, Lydia, they think, oh, we're just housing. But you're not just housing when it comes to Aboriginal affairs. You are much more than that. And that's what we deal with as Aboriginal people in our communities on a daily basis. And I've been around a long time fighting this cause to say to them, co-invest, so that you can also teach us how to co-invest and how to build our own circular economy in our own communities. How do you empower us if you keep trying to drip feed us? It's a gumbutter and our mullah. That's what it is. It's a program we developed as a community with my elders that we believe would actually drive our future. You know what? They all love the program. They love the reports. But it only cost $25,000. It didn't cost millions of dollars. But the main thing, it was owned by my people. My community owned it. So, again, there's reports which I can pull out on the shelves that's costed thousands and thousands and thousands and thousands and thousands from to tell us what we already know. If we're allowed as a people to be able to drive our own future, then I know for a fact, I know because I'm out there fighting it every day, to ensure that there's a better future. Our kids have got nothing. If people think that our kids have got a brighter future, you got to get that. It's not right. I've raised my kids in communities where the education levels were lower than mainstream society. My kids went to school in these communities and come home, and they struggled. My kids still struggle, but they're out there doing their best. But was it my fault taking my children into communities? No. That was an experience that they needed. So there's all these different things, and with government at the end of the day, we need to stop wasting funding. We need funding to be directed directly to those organisations and to those communities so that those communities can stand on their own 2 feet and drive their own future, because it's not going to work any other way.
Just have one last question. In the interest of time, your submission outlines very comprehensive recommendations for the Commonwealth Government. For the benefit of the committee, are you able to summarise some of those, please?
Yes. Structural reform of housing and funding frameworks. The Commonwealth immediately review the eligibility criteria for Housing Australia Future Fund First Nations housing stream. I've raised this in those meetings with those agencies. They said that they've noted them. And community housing future programs to remove classification barriers that exclude smaller and regionally based ICHOs from accessing funding for which they otherwise qualified. We were qualified, but we had to be build ready. The government has not looked at, and I've just looked, I think it was a 2007 report I have asked for and I got it, because there was a certain amount of money from federal to state to be able to assist with the management of the community housing organisations, the Indigenous community housing organisations. We had over 200 and something ICHOs in the state of Queensland. I think we've got 60 and it's getting less and less and less. Some of us out of those 60 at the time, I think because there's a couple have already closed down, which is so sad, there was only 10 of them registered under NERSH. But to actually get registration from NERSH and then get funding from the department, you had to sign an agreement, and I helped one community, this is a community story, you had to sign an agreement and they took your deeds. If you wanted that money back, it was a repayment scheme. You had to pay them back to get the property deeds back. But it was only a couple of $100,000. And that organisation never had funding since the closure of ATSIA. So this is why, like our community organisations, say Jupiter Mossman is one of many in our state, but they only operate on rental income. How do you expect a not-for-profit entity running on rental income that is only 74.9% of the rental market to be build ready? How? I don't know. That a dedicated First Nations community housing funding stream be established with flexible criteria designed for organisations like Jupiter Mossman, which is Tier 3 nurse providers operating outside major urban centres. There is a few that I know that are out there and they get a lot of funding. What about these little fellas in the back here? Back when I was in ATSIA, I remember the time when these little organisations were left behind because the bigger ones had a bigger voice. So there's no fairness across the board. That the Commonwealth Commission and National Audit for the First Nations community housing organisations, currently excluded from major housing funding streams due to classification disadvantage with a view to quantifying the housing gap created by this exclusion. I actually said to the Minister who, because I put questions up on the screen, and they were trying to bypass the question, but luckily the Minister said, because I asked the question, how many ICHOs in the state of Queensland have either applied or actually got funding? They were going to bypass that question because it come down to the funding, but the Minister at the time said, yep, I want to hear that question, read it out for me and give me an answer. So luckily for that, Minister of Housing was able to refer to that question. That the Commonwealth adopt a whole of government co-investment model for Indigenous housing. Do you understand what co-investment is? Co-investment is about all agencies coming together as one and investing into the purpose of housing. There's more, the government accountability and program continuity. We're sick and tired of the drip feeding. They say to us, for business, as blackfellas, it's a scary thing. I always say to our mob, the only way that we can survive in today's society is start operating our organisations as black businesses. They got to be businesses and we've got to run them as such. But to run a business, a minimum at least 3 to 5 years. So how can you invest into an Aboriginal community organisation or community for less than that? Because we're always being funded on the government's agenda instead of our own future sustainability and our own economic growth. Safety. I'm going to stop. There's so many things that we could go on with. Like Lydia, I've even said to you on a couple of comments, I'd love to chat with you because these are all the issues that no one's listening, No one's listening. And this, what you have chosen today to do and around the country is amazing. But it will not work if what we share with you from our truths is not heard at the top.
Thank you. We've had Mr. Formal join us. I'm wondering if you wanted to provide an opening statement for the committee.
Ji, bilang kata nyundo ba, ngai bama marba yengo bolma yeden bama ngacam walau para gimoy bara bamanda yengola gimoy bara nyundo ba kana kata yengo japo yapande marbo yirinji bolma yirinji bamanda. Well, first of all, good afternoon. And I'd like to introduce you to this country here, home of the Yirinji people. my people, specifically the Wallumbara clan from this Yidinji nation, whose jurisdiction covers from the Barron River up through the Tablelands and south to the Russell River. My opening statement is one of truth-telling via my personal experience and also, in a way, anecdotal in somewhat way and also analytic too as well. I want to frame my deployment of conversation with the panel and over this time, this very short time in dealing with this issue of racial vilification, discrimination against Aboriginal and Torres Strait Islander people by pointing out of overt and covert operations of racism that extend from colonization of the many people of this continent that some call Australia, but many today call home. So I'll start with, today I speak about racial discrimination against Aboriginal and Torres Strait Islander peoples in what some deem or term Australia. Discrimination that is not only a matter of individual prejudice, but also a matter of institutional design, policy outcomes, day-to-day administrative practices, and an unequal distribution of power. Racism is often described as something obvious, slurs, attacks, humiliation, but racism also operates quietly through misclarification, gatekeeping, underservice, over-policing, and disbelief, as I've heard also from the speaker before me. These are forms of racism that can be harder to name, harder to prove in court, and easier for institutions to deny. The effects are measurable. They are visible in life outcomes, health, housing, justice, contact, education, participation, employment and earnings, and the emotional burden of living under constant risk of being treated as less than, not because of character, but because of race. And here is where I will reference the term that was once deemed as colonial exhaustion, but nowadays is termed with black fatigue. Racial discrimination appears in two broad styles: overt racism, acts and statements that are explicitly race-based, and true covert racism, exclusions or harm delivered through neutral systems, forms, discretion, performance targets, thresholds, implicit bias, and practice that disproportionately affects First Nations people. In practice, discrimination can show up as being refused service or experiencing unexplained delays, being treated as a problem rather than a person, being spoken over, not believed, or managed rather than supported, receiving harsher responses into institutions that should be rights-based, criminal justice and child protection outcomes reflecting unequal risk and response. This is why many Indigenous scholars and community representatives describe racism not only as an individual act, but as structural condition, a pattern produced by institutions over time. Since 1788, the allowance of this to conclude and perpetuate until now, present date, 2026, is by effort diminished in the eyes of our people, the First Nations people. An influential Indigenous academic framing appears in the work of Henrietta Four-Mile-Marie back in 1993, which is many decades ago, but still her work proceeds today as being true, and also there needs to be conversations still held today, which is why we are here. Particularly the idea that racism can be embedded within institutions and persist through the contemporary operations of colonial arrangements. Four-Mile's work is significant because it argues that racism is not merely incidents, it is a contemporary continuation of colonial power maintained through institutions which are the guardrails of colonialism that shape who is seen as legitimate, who is believed, who perceives support or receives support, and who is punished. When we talk about institutional racism, we are not excusing individuals, we are recognizing something more, demanding that even well-meaning systems can produce harmful outcomes through their rules, incentives, and discretionary practices. There is strong evidence that Aboriginal and Torres Strait Islander peoples experience discriminations within the construct of Australia at higher rates that non-Indigenous Australians, include discrimination connected to accessing services, policing and justice settings, education and employment, housing and homelessness services, interaction with government agencies as well. Where data is collected consistently, it shows that discrimination remains a persistent experience, not a relic of the past. I have more here written in front of me, but I think I'll end quite briefly with also adding to the table of contents here today in conversation that the institutions such as the museums still hold today under the disguised sovereignty of Australia the possessions of our ancestors, our cultural connections to the country, which then is formidable in the usage with our youth to determine a stronger, brighter future, and this through culture and learning. These instruments and tools that are catalogued within the museums are held within the museums in boxes, in crates, in dark, dusty dungeons, and multiple items into the thousands are collected within these institutions. And under the so-called sovereignty of Australia, our reach and advantages of our own history, the original history upon this continent, is somewhat of a quest to gain even one's eye upon these objects and these items. The items that can be once again represented in the formidable ways of excluding our youth from troubled trajectories into a society built and honed around colonialism. Some anecdotal reference also the doctrine of discovery also comes to my mind, and some would say that the CCD, or the collective colonial delirium that exists within the country and its highest excellence of governance, persists to suffer with my anecdotal, once again, diagnosis of CCD that exists within the highest forms of government of this nation. We are within a world stage and the world arena with international laws that some have been ratified in this country, but we see the lack of legislation that put these rightful justices into place. I quote, not verbatim, but in my own words maybe, just in case I may speak wrongly or not word for word, a quote that was written by playwright Robert Merritt. And he said, a way to genocide is to take a culture and crush its credibility so it no longer reflects itself. And what I gather by this, and I will also protrude through my voice, is that when we step outside our doors, we don't see a reflection of whom we are as Indigenous peoples. Yes, within our own abodes and homes, we may have our paintings, our ritualistic songs and dances being connected to, but when we step out into the community, there is such a lack of this. Specifically here in far north Queensland, and specifically here in Gimoy, which is the real name or the original name that the city of Cairns now lies upon, we see tourism taking our culture into a trajectory of commodification into the world of trade and commerce, and not its pre-existing form of culture and what that should be recognized as, because culture and the connectedness to our language, histories, land, airs and waters is part of our governance. The sovereignty issue in this country needs to be looked at and focused with a magnifying glass, because for me personally, I'm not happy being 3% of a populace. I would rather be 100% of a people's. And I am here today for everyone to recognize that I state that as a fact, that I am 100% of a people's, not 3% of a population or the populace of Australia. Thank you.
Thank you very much for the opening statement, Mr. Formal. We might do another round of questions with the committee, but I was going to go to Mr. G.
Yeah, thank you, Chair, and thank you both very much for appearing before the committee and for your evidence. Ms. Huxley, I was going to ask you about your joint submission, and in it you referred to the Jumbin Community Safety Incident in March 2026. I was wondering if you could tell us a little bit more about that incident and what went on.
I wasn't in the community at the time, but I got the phone call. Young fellas on four-wheelers went up to the falls. We have certain rocks placed around our community that identify the massacres. Yeah. Just recently, we were able to put some signage up and a plaque on one that's beside the road. And we were able to do our cemetery and also put a story up about a child, a baby that was then buried back on community, on country. These young people were on their four-wheelers. They drove up and they decided that they would just do wheelies, burnouts on an area that belonged to our community. A couple of our young men went over and asked them to stop. and they decided to retaliate with racism. A certain couple of individuals left the community threatening to shoot them. They then went away and come back with a gun. Police were called. It was though that it wasn't a priority of the police at the time. All I could say, if it was a white fella's doing it, the police would have been, a black fella's doing it, the police would have been there straight away. That's how I see it. I done my own investigation and found out exactly who they were, and advised the police. I wrote to the Minister McCarthy. The saddest point about the response from Minister McCarthy was it was only just about 3 weeks ago that I got her response. The other ministers and I think it was the police and stuff, they've been responding over time. But the incident shook up our community. My cousin, sister and that families were all locked inside. They were that scared that these people were going to come back and shoot them, that they heard gunshots being actually shot off. So they locked themselves inside and closed and turned the lights out and sat in their homes in the dark. My mum wasn't even able to come to work that following Monday because they were still scared. Why is it that this has to occur in this day and age? They thought that they were tough, that they could go and get a gun and threaten our people and say that they were going to shoot them. It wasn't nice. I jumped in my car, I was out in Charles Towers, and I drove all the way home to Jumbun to deal with the issue. I don't know what more I could say. It was not nice at all.
The response you got from the Minister 3 weeks ago, was that a satisfactory response?
No, it wasn't. I thought I would have got more than just that. I thought I would have had ministers come to the community to hear the voices of our own people, to hear how frightened they were. You can't put that in writing. How can you put it in writing to ensure that those reading it could feel it?
Thank you. And you've also submitted evidence of racism at the on-country connection camp.
Yep.
Do you mind elaborating on that?
So I'm the chairperson of my RNTBC.
Yep.
And we decided that we needed to bring our people back to country to be able to heal as a people, as Goodwill people. So we thought we'd coordinate a camp. Through the council, we asked for permission if we could actually book out the Fletcher on one side. Now, the Fletcher is a very high tourist populated area.
Yep.
We got some signs done. The council put up signs, and certain individuals were residing there at the time in their van, and a lady decided that she would write on the signs that it was government paid for. The lady was confronted by my sister and just asked what the problem was. What the problem was is that they believed that we had no right to meet on our own country. They had to leave. We gave them the next section across the road. Any campus could still have that. We were just closing off a section to be able to bring our families and our children and our grandparents to country, some of them for the first time. But to actually see that written, which we've kept it as evidence and we've taken a photo, to see that it's written there to say, racist remarks. Government didn't fund our on-country camp. We did. And it was to be able to heal as a people and to bring our family members back to country. That lady and that gentleman at that time, they didn't care. They felt they were being disadvantaged because they had to move across the road. What we learnt from that is that we as Goodwill people, even through native title, we still have no rights. Native title is a farce because we have to ask for permission to use a campground, which is public ground. We didn't have to book it. We didn't have to let council know that we were going to do it. We didn't have to go and see QPWS to let them know that we were going to be entering the park to ensure that we could share our fish traps and all the rest of it, those areas. But those people thought that they were disadvantaged when we, our people, my children, my grandchildren, we've been disadvantaged and displaced from our country for too long. And those people, two people, thought that they were more displaced than us. Sorry, I'm frustrated about that, so.
No, I appreciate you sharing that with the committee. So thank you for that. The other thing that I just wanted to discuss with you was in the joint submission, and you've already touched upon it in your words today, but 2.2, the pattern of government-driven initiatives. And I think you put it in these terms: every time a new initiative arrives, our people sit back and wonder what is coming next. How long will this one last? Should we build our programs around it, knowing it may be gone in 3 years, or do we hedge, participate just enough to access the funding while protecting our community-controlled structures from being absorbed into something we didn't design and don't control? And then a couple of paragraphs down, you say, the only structures that survive these cycles are the community-controlled ones, because they are accountable to community, not to government.
That's right.
And that basically summarises your submissions to the committee, doesn't it, in terms of...
I'm sick of our people being a political football.
Yeah.
Because every time that they want to, I don't know, government changes and they got to change their policy because someone's got another thought, they don't think about us.
Yeah.
They don't think about how that would affect us. So, of course, they're going to use it and kick us to the next level or kick us over there. I'm sick and tired of being that political football. Our people are sick and tired of it. Because every time these policies come in, I've run programs in our communities where we're so successful and we're getting the highest KPIs and we're probably one of the best in the state. But then the new policies come in and we're going, oh, shit, we're nearly there, wait there, please. If you just allow us to get to the stage that we need to be so that we don't have to worry about the drip feeding,
yeah,
right, we won't need future government funding. This government has a responsibility to the First Nations people of this country. And that means co-investing into those priorities that are driven and owned by community, not by policy. People can develop housing policies, but that housing policy is not suited to our cultural law, our priorities. For example, I'll give you an example about housing. In our community in Jumbun, our family, it's made up of our family. You can't bring nurse into our community and think it's going to work just so that we can get your funding. The nurse won't work because the community is the people that reside there and have been there from day dot. You can't bring outsiders into our community. So the nurse program won't work. But because we're not nurse registered or we don't get nurse registered, does that deny us the funding for our houses? Yes, it does.
Your words struck a chord with me because I've got an example from my local community. I live in Orange in central western New South Wales, so we're about, 3.5 hours west of Sydney. And out there, the Indigenous peak bodies got together with some teachers from one of our local high schools and decided that they would set up a program, a school in effect, to take boys who were in danger of becoming disengaged with education outside of the school and to teach them at a new location on the banks of Lake Canobolas, and also to reconnect them with education and reconnect them with country. And it is a highly successful program. It really works. But for a number of years, they have battled the New South Wales education bureaucracy, who can't get their heads around the fact that they don't control it, and that this program needs support, and in fact could be a program which other communities in New South Wales and some around Australia could actually follow. But you've got these teachers knocking themselves out, picking up kids to take them out to the old, it's called the old scout camp, but to the site at Lake Canobolas, and it just doesn't get government support because they're having trouble getting bureaucrats in Sydney to get their heads around the fact that it doesn't fit into their neat programs, and they don't control it necessarily, even though these teachers are still employed by the local high school. So I think your words have a great deal of resonance, and I think that it is certainly something that this committee can take on board in terms of its recommendations at the end of this inquiry. So I thank you for coming here and sharing that with us. It is much appreciated.
Thank you.
Thank you. Mr. Smith.
Hey, Carl. Just wanted to acknowledge, what your family has meant and the leadership that your family has provided to Cairns forever, and congratulate your family on the Yenny building being named for your great-great-grandfather at JCU. You've performed Welcome for Countries. They're always a fantastic, really quite moving. Have you noticed a shift in the way people approach or react to Welcome to Countries? And I also noticed in the last few years you've changed it from a welcome to an introduction to country.
Yeah, in regards to that, Matt, I've had to pivot into thinking about my perspective on what Welcome to Country is, and so we've thought this out over the many years and the many periods within those years of how can we make this a more functional mechanism for our people and the next generation who are to take over this way of governance and providing sustainability and security and a platform of voice for our people. And so to do that, we decided to not welcome any government agency, corporation, outside entity that we have not yet built a relationship with. That has to be formed over time. So identifying this as a new way to form the instrument, we had to coin the phrase introduction to country, where we would introduce people that come from near and far to the governance systems of our people, to the language of the Yidinji people, to the homelands, to the cultural lens of the geographical area of our people, and then state that by doing this, we are creating contact first of all, and then in the near future, when we do persist to have preservation of the needs and fulfillment of what we need as a people, then we can form those relationships, build those fundamental friendships and partnerships, and then, and only after that happens, we will then be able to welcome people once again from near and far onto the sovereign unceded lands of the Yidinji jurisdictions under the guidance of the Yidinji people. And that has taken quite a response from people that have visited Gimoy, some refer to as Cairns, and the Indigenous people that have been witnessing how we are forming this new way of introduction to country, of providing the cultural visa to Yidinji country, have also spoken that they may well take that back to their country and introduce that as a way of forming relationships with outside entities, once again, governments, corporations, organisations, so on and so forth, that are built and designed within the construct of Australia. So I now also would like to mention, just in response to how welcome to countries are received, I have initiated a Yidinji national anthem, and it's quite it's a good mechanism. It's a social experiment that I'm conducting myself each and every time I get out there in the community in front of audiences and ask people to stand. If they're able, please stand for the Yidinji national anthem. It is something that I hope does catch on around the country, and it is something that we are very proud of to have being birthed here from Yidinji country. To have our own national anthem being attended to and listened to and then engaged by audiences, whether local, state, national or international, is speaking in terms of self-determination in a practical mannerism. And some of the looks from some of the audience members are some of curiosity, some of absolute disgust, and some are smiling audiences that are very pleased that we are doing this as a part of our next step into self-autonomy and, once again, self-determination upon our own sovereign homelands of Yidinji jurisdiction and geographical territory. And I thank you for the question, Matt.
Thank you. Senator Thorpe.
Thank you, Chair. Thank you, Mr. Formal, for appearing today. A lot of what you said is what I do in the Parliament. I'm considered crazy, I'm angry, I'm radical, even by my own people, for saying we are sovereign and that it's colonisers' headquarters and that the colonisers are continuing to commit genocide against our people. They meet the 5 definitions of genocide: stealing our children, causing harm to our people, deaths in custody, incarceration, sterilisation of our women. The colonisers meet the definition. So my question is, you know, we talk about unity amongst ourselves, blackfellas, and the racists love to see us bringing each other down, fighting one another, because that keeps us busy while they rape and pillage our country and our people. What do you say, because we're considered on the fringe here, but what you say is so beautifully articulated in exactly what is going on in this country. How do we bring the rest of our people to understand what you're saying? Because for so long our people have been oppressed and assimilated that they're starting to think white way. But what you're saying is what is going to save us as a people. So what is your message to the people who've lost their way, who need to come back? What do you say to that? Because some of those people are giving the government advice on how to run our lives, and they've lost their ways. So how do we bring them people back in, and what kind of message can you give to them that we're not crazy? This is the oldest law of the land, and that's what you're talking about. And thank you. I could sit and listen to you all day.
And I can sit and listen to you all day, and thank you for the time and the response and the question. Sister Lydia. Look, I think it's a matter of cognitive and psychological evaluation that our people need to educate ourselves, whether that starts at home and whether that needs to be within the curriculum and education system. I think is definitely a way to solve some of the problems. And there are many issues that also could be extended into the remedies for our people when it comes to the psyche and how we think within a colonial system, mechanism and world that have oppressed the First Nations people for now 238 years. I do congratulate those that do push through the system, such as yourself, being a part of the system and still being very rooted in your culture and your psychological design via your DNA and the connection to your peoples and your customary laws and your ways that are evidence in the natural laws. The education system obviously does not fit the criteria when it comes to extending its reach and arm and responsibility to our children, because it's simply connected to Indigenous communities because of trade and commerce. Trade and commerce is not a bad thing. The disingenuous article about trade and commerce and its desires is that it extends or originates from colonial values. We still are yet to see many Aboriginal communities or First Nations communities with schooling systems and curriculums that are embedded within a two-way learning system. We still fail to see throughout the continent, once again, that some call Australia, but many call home. In these communities and Aboriginal communities, we still fail to see agriculture being set up. We still fail to see housing that benefits our people. And when I talk about housing and also the infrastructure around that, whether it's water, sewage, electricity, power, energy, whatever it is and may be, this is still done from the colonial perspectives of how trade and commerce is pushed and revitalized into neocolonialism into the future, using our communities as basically a model of efficiency when it comes to not rectifying the problem, but a band-aid solution. Some of our communities are rich in natural resources, have our own timber, and once upon a time, an example, just 40 kilometres across the inlet and over those mountain ranges that our people call Bundaganyara, which translates to the Crocodile Mountain, which, to educate some that are here today and listening, connects us to our natural world, because those mountains, Bundaganyara, is a reminder of the story and connectedness of the crocodile. It translates to the Crocodile Mountains. So that offers, in our own education system, it offers environmental assets and conversations among conservation and how we then intertwine with the natural surroundings around us. But we are yet to see this type of education and curriculum be within the boundaries of our Aboriginal communities and schooling systems, and wider variety of schools around the continent, whether regional or metropolitan too as well, which could also, in terms of education, upon this continent especially, redirect how science, conversation and education is perceived and attributed, and also offer a brighter future, especially for our communities. I offer also, in terms of belligerent occupation, that there is also responsibility when we talk about how to rectify or solidify solutions when it comes to massive issues that are not right in front of us at face values, but hide behind closed doors or over walls that interfere with how we see truths in this country, such as protecting Indigenous property rights via biodiversity. And when we look at biodiversity and talk about biodiversity, especially in this country, but not only in this country, but around the world, but back to this country, I maintain that the ICIP, or the Indigenous Cultural Intellectual Property, the skills, the knowledge, the know-how that have been usurped of our people, of our old people, of our ancestors, and then placed into many books, many literatures which serve purpose and monetize a situation for Australia, the country, the corporation, the business. There needs to be conversation also about benefits sharing. And we know that these have been conversations had in the past, and they continue to not be persuaded into or funneled into an avenue of ratification, once again via legislation or policy, and also for the benefits of Aboriginal communities, which could sustain themselves into the future, generating millions of dollars per annum if seen fit by the people of that country to generate agriculture of native bush plants that go into the food security industry, not only for Indigenous peoples upon this continent, but also the diversity of different races and multicultural people living now within this country. Because we must not forget that food security and water security is a conversation that is happening today in government. And how can we provide safety within this area for the population? Once again, not just Indigenous or First Nations, but whomever may claim to be here building home, finding peace in the beaches, in the freshwater creeks, from the beautiful climates around the continent. This is very irresponsible of Australia to not be looking at ways of forming real partnerships, real business opportunities with its Indigenous peoples. Now, some of these items have been taken all the way to the United Nations, and Australia chooses, although being signature, as you guys know, that some of these things have fell short of what this country should and could be. Now, the ICIP that is utilised, once again usurped from our ancestors and the knowledge of Indigenous people here that has been honed over more than 65 millennia is an interest to this country because, and I point out an exhibition that we just recently held, which was titled Cultural Knowledge is Currency. And we can see how this country then designates its time to extract knowledge and the intellectual property rights from Indigenous people and communities, but then once again play possum when it comes to benefits sharing. Because to gain knowledge and to see that within the bush food industry, within the cosmetic industry, in the environmental and conservation industry, within the massive medicinal industry that is the basis, or the knowledge of Indigenous peoples here is the basis and foundation of all of these industries. When looking at how Australia operates as a corporation, as a business within the global arena. So we then go back to the start of the opening representation of what I said, that some of, the racism that occurs and continues to perpetuate in this country is not only overt, but remains covert also. And the covert operations of racism actually incubates and breeds the overt style of racism in this country that we see on the streets, in social media, so on and so forth. Thank you.
Thank you, Senator Thorpe. That concludes the time that we have for questions this afternoon. Thank you both for your time and taking the time out of your days to come and share your stories. The committee is grateful for that. If you've taken any information on notice, I expect there might be some questions on notice from committee members. We are asking if you get those to please return them to the committee by the 19th of August. And after today, you'll be sent a transcript from today's hearing as well. And if when reading through it, you see there are any errors there, you can request corrections to any of the errors that you find. So thank you very much for your time.
Senator, can I just say one last thing? I'm too white to be black and too black to be white. I live in between the worlds, but I've always been a proud Aboriginal woman. And sometimes when government looks at me, the thing is that maybe I don't know, but I've lived experience. And I've been an Aboriginal woman all my life. And sometimes, our own people question me because of my white skin. So I've experienced racism on all different levels. And this inquiry realistically needs to step it up and take it to the top so that our people continue, stops experiencing the racism, and that we as Aboriginal people can be proud of who we are and what we stand for, especially being sovereign mob from our own countries. Thank you.
Thank you. Thank you very much. And your final words has prompted me to also just say, for transparency purposes, you mentioned the ILSC earlier. And I wanted to say that my husband is on the ILSC board, just for transparency, a recent appointment. So thank you very much. We will now suspend for a quick afternoon tea break. I now call on Dr. Craig Leon to give evidence. For the Hansard record, would you please state your full name and the capacity in which you appear?
Yep, full name is Craig Leonard Leon, here as an individual.
Thank you very much. Although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false and misleading evidence is a serious matter and may be regarded as contempt of Parliament. The evidence given today will be recorded by Hansard and attracts parliamentary privilege and is also being broadcast live on the Parliament's website. You can see from our nameplates who is joining you today and will soon be back in the room, no doubt. I now invite you to make an opening statement.
First, I want to acknowledge the Unity people, the traditional custodians, Cairns, paying respect to the elders, past and present, and particularly I'm on Goomoi country here, known as Cairns. I myself am a Warramai Aboriginal man, Foster, New South Wales. I've spent most of my adult life prior to the public service in Canberra living here around this region, so I know it really, really well. Thank you for the opportunity to provide evidence. My research examined the impact of unconscious bias on First Nations employees in the APS, Australian Public Service. The evidence demonstrates that racism in Australia has not disappeared. Rather, it is often experienced in subtle, systemic and institutional ways that are difficult to identify, challenge and measure. While overt racism still occurs, many Indigenous employees describe experiencing stereotyping, lowered expectations, pigeonholing, exclusion from career opportunities and the need to continue to prove their capability. A key finding of my thesis is that racism is not solely a matter of individual attitudes. If unchecked, it can become embedded in organisation cultures, policies, decision-making processes, and these are often very subtle. Unconscious bias acts as the invisible engine of systemic racism, and where widespread, hidden prejudices shape the policies, hiring practices, and institutional cultures that lock racial inequality into society. When institutions fail to recognise these racial differences, they also fail to recognise racism itself. Racism harms individuals, weakens organisation and undermines public trust. Addressing it requires more than awareness training. Sorotka in 2020 in his landmark study found that 3 in 4 Australians hold a negative implicit association or unconscious bias against First Nations people. So if you like, are racist. If Australia is serious about equity and closing the gap, we must move beyond acknowledging racism and commit to dismantling the systems that allow it to persist. Thank you.
Thank you very much. We'll proceed to questions and begin with Ms Cook.
Thank you, Chair. Thank you for coming in today, and thank you also for your statement. How can employers, including government agencies, better measure, monitor, and address systemic racism?
Yep. It's a multifaceted process, not just one way. The obvious thing would be starting with education, having people aware of people's diversity and how that impacts someone's lived experience. For First Nations people, we have to walk in two worlds, particularly in the public service. So, I mean, we come in as with our cultural identity, belong to community, and we've got to live our identity, and we're also then going to be professional APS public servants. And often that is a clash, you're walking into worlds. I guess a good example of how that can be really hard is when the NTR intervention came into being. Being an Aboriginal public servant, that was very difficult. We had two choices. We either left, a lot of us did leave, we stay in there to try and help smooth that process and try and stay within the tent to make some sort of change. The APS is quite active on trying to reduce and eliminate racism through the Commonwealth Aboriginal and Torres Strait Islander Workforce Strategy and various initiatives like the SES 100, trying to increase the senior representation in the SES, which is really critical. However, our employees still are overrepresented in the lower classifications. And if you think about who would be the most largest cohort at risk from racism, and particularly from unconscious bias, would be women in the lower classification, Indigenous women in the lower classification range. Because we know 2/3 of the First Nations employee force are women, and they're generally, on average, in the lower classification. So they're up against it from day one. The APS has taken a lot of steps to eliminate and reduce racism. I helped to create the unconscious bias training program the APS has for employees in SES. So they're on the right path, but there still needs fundamental change in how we embrace and empower and value First Nations people because of that cultural clash of walking in two worlds. And it's a well-known fact, so it's not something I'm making up. But the sooner the APS can come to grips with what that really means, and then they can start being a innovative organisation and applying cultural competence and cultural capability for benefit of all public servants and obviously the service for all Australians, not just First Nations employees.
Thank you. And on that topic, in your PhD, you say that the APS should consider institutionalising an Indigenous-led knowledge and understanding of cultural competence to improve Indigenous employment. Can you talk about that a little bit more, but also any thoughts you have on what this committee or what the federal government could do to do that?
Yeah. Okay, so what I'm talking about in that there is, if I looked at APS in 23, so all my time, 25 years in the public service, and over that time, public service is always committed to First Nations employment and development retention. But what it did poorly was apply cultural competence haphazardly. Cultural competence as a concept, essentially, Cross and others coined it in 1989, and they placed cultural competence in a systems environment to help an organisation or an individual or agency to have greater cross-cultural relationships. I like it because it's a systems approach. The APS has, in past, not really understood or grasped that concept well. So what it's allowed to do is blur the meaning with other cultural concepts such as cultural awareness, cultural integrity, cultural capability, cultural safety, cultural responsiveness, and goes on. If we keep doing that, we blur the intent of cultural competence. Cultural competence is that foundational building block, that foundation on which you can draw a line in the sand and build your cultural competence strategy on that. For the APS to get really good at that, I recommend, in my thesis I've said, we don't need to focus on all cultural concepts, but cultural integrity, cultural safety, cultural capability seem to be the big three. If we define those alongside each other, so we don't overlap the continued blurring of that, we can then put them within a holistic framework for organisational change for a cultural competent APS. Until we do that, fundamentally, we have no way of measuring cultural competence change. So what the APS needs to do, right through this committee, is really, I guess, ramp up the need to get serious about driving a standard approach to measuring cultural competence and drawing that line in the sand. Until we do that, we'll be still having this conversation 10, 15 years' time.
Are there any measures that you think are working at the moment to combat racism and combat that unconscious bias?
Yeah, there's lots of things that happen in sort of, not in isolation, but all at once, all over the APS. Unconscious bias training, the implicit association test, is what my research and Sharodka's research used to allow an individual to get a level of implicit bias for that person. I think if the APS, and it wouldn't take much to establish an APS baseline for cultural unconscious bias by using that tool, the implicit association test. Now, in the past, that platform has been removed by Project Implicit, and it was removed because of the controversy around the images used in a test like the implicit association, where it used traditional historic images of white Australians and black Australians, when you know for Aboriginal Australia, I as myself, it's a much more complex, multivariate. So, but for a test like the IEP, those images are very stereotypical images and they work well. So that platform doesn't exist at the moment. It's something I've been personally looking at to reinventing. But the APS did that as a form of measuring unconscious bias. It could draw a line on sand for years out to actually measure the change in unconscious bias in the public service. Now, there are limitations with that test, as in most tests. Individually, your level of implicit bias measure that you get for that can change from different context to different context. But when all that data is aggregated and moved up to report, say, from a APS department or agency, it's been proven to be very reliable and very valid. So from an aggregate amount, it would be quite meaningful.
Is there any legislative change that you believe is required from a federal government perspective to address these issues?
I think I'll take my hat off to the ACT government. Now they have the Amendment Act, Closing the Gap Amendment Act, which for the first time legally requires all SES officers in the ACT government to be held accountable for closing the gap outcomes. They're the first jurisdiction in Australia to do that, so it's really quite progressive. Without making a change in the APS Act, something similar in a legislative form, that would be huge if we could do that, or if at the very least into the regulations in the APS.
So you're saying, just so I'm really clear, it is possible to make, it would be possible, the ACT government has done this in terms of a legislative requirement of their senior executive staff to be accountable for the outcomes of closing the gap directly through legislation.
Yes, particularly around cultural safety, institutional racism, and cultural capability.
Thank you. I wasn't aware of that. That's my questions, Chair. Thank you.
Thank you very much. Just two questions from me. One is following on from Ms. Cook's question. She asked about legislative change. One of the other recommendations that has been put to this committee is that we should look at a positive duty of care around the Racial Discrimination Act for workplaces, in the same way that we have a positive duty of care for the sexual harassment and discrimination in workplaces. Do you see that would be something that would be useful?
Potentially. We have the Racial Discrimination Act now. So why is that act not really working? Maybe that...
Well, I think the difference is that the onus would be, like, for the positive duty of care, it requires, the onus is on workplaces to have a workplace that is free from those things. And so it essentially, from the evidence that the inquiry has received, workplaces have had to really change how they work and think proactively about how they keep people safe in their workplaces, free from sexual harassment and discrimination in a way that they didn't. I suppose the criticism of the Racial Discrimination Act or any of the kind of other piece of legislation is that they're reactive. They wait for somebody to bring a complaint to you, rather than it being on the workplace to have a being responsible for having a workplace that's free from racism.
Yeah. I guess my short answer would be anything would make a difference, right? But we don't know what may be the unintended application of that down the track, because it wouldn't be tested. But it's something we can start. I think if I go back to the Public Service Act, where agency heads have all these powers, if you put something in there specifically, that would be much more powerful.
Yeah. Thank you. And then my final question is just, if you've talked about your thesis and the work that you've done, I was wondering if you'd be able to provide that to the committee on notice.
Sorry?
I was wondering if you can provide your thesis to the committee on notice.
Yep.
That would be really helpful.
Yep.
Thank you very much. That concludes the time that we have. That concludes the questions we have for you. I imagine there might be some questions on notice coming your way.
Yep.
And if that happens, if you could please get those back to us by the 19th of August, we'd be really grateful.
Yep.
And thank you for juggling diaries and moving some bits and pieces around to accommodate the committee. Appreciate that we've mucked you around a bit this afternoon, so thank you very much.
That's good.
And you'll be sent a copy of the transcript from your evidence today, and if when reading through it you see there are any errors in there, you can request that those errors be fixed.
Always.
So thank you very much. We will now suspend very briefly while we welcome next witnesses. Thank you. I now call on representatives from the Australian Indigenous Doctors Association to give evidence via teleconference. For the Hansard record, would you please state your full name and the capacity in which you appear?
Sure. Peter Maloof, I'm the Chief Executive Officer for the Australian Indigenous Doctors Association.
Thank you very much. I've got a short spiel and then I'll let you know who's in the room before I invite you to make a brief opening statement. So, although the committee does not require you to give evidence under oath, I should advise you that this hearing is a legal proceeding of the Parliament and therefore has the same standing as proceedings of the respective houses. The giving of false or misleading evidence is a serious matter and may be regarded as a contempt of Parliament. The evidence given today will be recorded by Hansard. It attracts parliamentary privilege and is also being broadcast live on the Parliament's website. I'm joined in the room today by Mr G, Ms Cook, Mr Smith, Senator Thorpe and myself as the Chair, Senator Stewart. I now invite you to make a brief opening statement.
Thank you. Thank you, Chair. Good afternoon, all and the committee members. I'd like to begin by just acknowledging the traditional custodians of the land that I'm calling on from today on the lands of the Gadigal people of the Eora Nation, and I pay respect to elders past, present, and emerging, but also acknowledging the traditional owners on which the committee is dialing in from today. The Australian Indigenous Doctors Association appears before this committee from a health, workforce and cultural safety perspective. Our central message is simple: racism is not an isolated social issue. It is a determinant of health, a workforce safety issue and a barrier to Aboriginal and Torres Strait Islander peoples receiving care that is safe, trusted and equitable. Racism is not only expressed through individual prejudice, it is also expressed when public institutions, political debate and systems of authority legitimise fear, misinformation or penalise Aboriginal and Torres Strait Islander people. The 2025 APRA Medical Training Survey found that 56% of Aboriginal and Torres Strait Islander doctors in training witnessed bullying and discrimination and harassment, and including sexual harassment and racism, nearly doubling the 30% national rate of all trainees. 38% reported experienced and witnessing racism specifically. These are not abstract figures. They describe a condition in which the next generation of Aboriginal and Torres Strait Islander doctors are expected to train, work and lead. The Aboriginal and Torres Strait Islander trainee doctors are experiencing racism whilst trying to enter specialist pathways. Then the system is not only harming individuals, it is actively undermining the future of Indigenous leadership in medicine. To grow the Aboriginal and Torres Strait Islander medical workforce, racism in training, employment and regulations and health systems must be addressed directly, and cultural safety cannot be treated as an optional rhetoric or symbolic. It should be embedded in standards, accountability, complaints pathways, funding and regulations. Implementing the Australian Health Rights Commission's anti-racism framework across the whole of government would provide clear foundations and practical pathways for structural reform and accountability and prevention. The strongest evidence supports that Aboriginal and Torres Strait Islander-led solutions, cultural safety embedded in regulations and standards, and anti-racism approaches that explicitly address race, power, as well as community-led co-design and cultural safe reporting pathways, as well as stronger oversight, reform grounded in self-determination and accountability. I guess the question for us is not only whether further evidence is required, but whether government have the political will to act on what is already known. So, thank you.
Thank you very much, Dr. Maloof. We'll proceed to questions, and I might begin with Senator Thorpe.
Thank you, Chair. And thank you for appearing today. You play a very important role in our people's lives, so thank you for the work that you do. What are the main barriers for our people to work in the mainstream healthcare sector, and What are things that we can do to support it being addressed?
Yeah, so I guess in terms of responding to the two questions, the first one, I guess, in terms of barriers, the barriers are really institutional. So we know that institutions are not built in mind of our mob, and so policies and procedures are often are not culturally responsive to our cultural needs or understanding. And so, you know, in terms of workforce, you know, there needs to be more, you know, opportunities for mob to go into mainstream positions, but also the opportunity to be nurtured and supported. And so workplaces need to provide training options to be able to grow the next generation of Aboriginal people, particularly in medicine and health, to be able to move into those kind of next steps of leadership that can create institutional change. But also recognising that, you know, Aboriginal people that work within the health system often carry extra, I guess, responsibility, which is brought on by the institution. And I mean by educating non-Indigenous people within the health space. So there are often, you know, that cultural burden that's placed on Aboriginal and Torres Strait Islander workers to educate the misperceived and stereotypical views of, you know, non-Indigenous people that don't understand Aboriginal and Torres Strait Islander people. And so we have to then, you know, be that educator, you know, deal with the tolerance, and we shouldn't be in that space of that responsibility. It should be the institution that should be educating, you know, non-Indigenous staff. And I know that we have, you know, cultural awareness training, cultural safety training that we provide, but, you know, education is not enough. I think there needs to be more, you know, mandated, you know, engagement with community. You know, face-to-face workshops don't really provide, I guess, that level of understanding. I rather take, you know, non-Indigenous clinicians onto country so that they can be immersed with language, culture and understanding, so they can better operate within their current environment.
Thank you. I've been fighting for the 339 recommendations of the Royal Commission into Aboriginal Deaths in Custody since I entered into Parliament, and I've spoken to a number of Aboriginal doctors in the prison system who have told me that the government don't provide the right medications to keep our people alive, and one Aboriginal doctor in particular was told by the prison that she needed to contact the pharmaceutical companies to negotiate with them to get these certain medications in the prison that would keep a number of our people alive. I raised this with the Minister for Health, who's done nothing about it. I just wonder, you know, are there other examples of how Aboriginal doctors are basically begging for government to support their way of working, their solutions, and whether you've ever had a meeting with the Minister for Health to raise all of the issues that you might talk about today?
Yeah, look, I think we're in a space where, you know, we've got current consultations around, you know, so our regulatory body, the Australian Health Practitioner Regulation Agency, are doing they've done a consultation around the next iteration of the cultural safety and strategy. They've, you know, obviously introduced an anti-racism policy, which from my perspective, is it doesn't have any accountability or mechanisms for Aboriginal and Torres Strait Islander doctors or health practitioners to actually report into, nor is there a way to, penalise clinicians who are practising in a culturally unsafe manner, or the example that you had described. So I think, these consultations around our regulatory and quality safety commissions that are doing these external reviews at the moment, in my opinion, should cease until the end of the conclusion of this inquiry, because I think, this inquiry provides the in-depth and breadth of what is occurring in this space and how these agencies should be embedding policies and procedures that, one, that allows people to report, two, allow for accountability, and two, penalise those individuals who are actually causing harm to our Aboriginal and Torres Strait Islander patients and communities. And so, I get concerned when we have these types of inquiries and got at the same time these regulatory bodies who are supposed to be our regulators doing consultations without actually getting the breadth and understanding of our experience in the system.
Thank you. I'm happy to hand it over. Thank you very much.
Thank you. Mr. G, did you have any?
Yeah, just a...
Mr. G.
Thank you. Thank you for your submission and also for appearing today. You've said in your submission that Aboriginal and Torres Strait Islander doctors, trainees and medical students carry cultural load, advocacy expectations and professional risk while also navigating racism within training, supervision and employment settings. That's on page 9. Just wondering if you could give us some examples of some of the racism which you're referring to in training, supervision and employment settings.
Yeah, so I guess in terms of an example is that, an example of an Aboriginal non-GP specialist trainee who, as I've heard time and time again, have repeatedly been asked by, their colleagues whether, they gained entry into medicine through specialist pathways, and then subsequently been told that you must have had, an easy selection process, and which is then framed as this kind of curious and humour comment around whether the trainee being Aboriginal is competent or has entered into the training program with merit. And so, that kind of demonstrates, kind of micro expressions or aggressions, and this kind of raises this assumption that, Aboriginal people are not competent enough, but they have to seek special pathways into training. We have also heard from medical students, particularly when they're on clinical placements, where they've experienced their supervisors using racial slurs and statements about Aboriginal people, particularly them as medical students not suited to medicine because of their backgrounds, and so therefore they get excluded from clinical procedures and teaching opportunities. And so there's kind of racial kind of violence combined by racist humiliation and intimidation, misuse of professional power causes, to my perspective, psychological and cultural harm, or threatening the students' education, safety, and particularly their future in medicine. So they're two examples that I can provide.
And then you've also made submissions on the inadequacy and ineffectiveness of reporting mechanisms for that racism within health systems.
Yeah, that's right. So, there isn't a pathway for Aboriginal and Torres Strait Islander people to feel, or trainee doctors or students to feel culturally safe to report on these issues. We as an organisation are working at the moment to create a pathway for those doctors and students to seek support from us as an organisation so that we can help them work through how to respond to their experience, how we can be the conduit between them and the health system. But that's the work that we do, but we don't get funded to do that work.
Thank you.
Thank you, Mr G. Ms Cook.
Thank you, Chair. Dr Malouf, your submission talks about the solutions and that they're already known. What, in your view, is stopping them being put in place, and what could this inquiry do to ensure some of those things that you talk about actually happen?
Yeah, so I think, as I mentioned before, we've got, APRA at the moment, doing a review of their Aboriginal and Torres Strait Islander cultural safety strategy as well as their anti-framework policy. And then obviously we have the Australian Safety and Quality in Healthcare reviewing their hospital accreditation standards, which both have a clear focus on cultural safety and anti-racism. I just think that there needs to be a pause so that there is greater input, particularly from us as the voice of Aboriginal and Torres Strait Islander medical doctors. We haven't been engaged in those discussions, nor had provided our solutions or ideas to reform in those spaces. And so, we want to be at the table to have those discussions, so that our medical workforce are being heard and those initiatives are being thought and implemented. As I said, we want to be able to have pathways where our medical workforce feels culturally safe to report, but also there are actions within the health system that are actually changing the culture and the institutional approaches to dealing with those that are practicing in an unculturally safe way.
This morning, Dr Malouf, we heard from the RAC GP. What's your relationship with them? Are they inputting into those reviews?
Look, they are, and we acknowledge that each medical college has Aboriginal and Torres Strait Islander clinician-led teams. They're just one voice. We represent a multitude of Aboriginal and Torres Strait Islander doctors, as well as students, and we want to be able to have an opportunity to talk through that. One thing I would say, though, that will help the system even more is there needs to be a level of truth-telling across medical colleges. If we are to stamp out racism or eliminate racism, and also embed cultural safety in practice, then there needs to be a level of truth-telling among medical colleges to really understand the breadth and depth of trauma that has occurred since colonisation on Aboriginal and Torres Strait Islander people, particularly in the medicine space. That hasn't happened before, and I guess from ATSIA's perspective, we want to be able to go through a process of truth-telling in medicine so that we can start the journey of healing to improve on our practice moving forward.
Thank you, Dr Malouf. A number of people have raised truth-telling throughout the inquiry, but from slightly different perspectives, so that's useful. The RAC GP also spoke this morning about things like increasing the Medicare rebates for longer appointments as a way to combat racism in health systems, about systemic accountability, as you've also spoken about, and measuring to then be able to eliminate racism, adopting the Human Rights Commission framework. Are those all things you would also agree with?
Yeah, we definitely agree with the Medicare rebate to extend long consultations, because we've got to appreciate that the different experience of Aboriginal and Torres Strait people who've been traumatised, and these initiatives allows for more of a trauma-informed approach to ensure that we are creating appropriate care and taking the time to understand a patient that comes into care. Yes, there's currently the rules around, standard consults, and there's a time frame. You just can't rush consultation with Aboriginal and Torres Strait people. It's about, as clinicians, building trust and rapport and understanding, and as well as making sure that Aboriginal and Torres Strait people are heard in the healthcare system, and particularly consultations. So yes, we agree.
And just a final question. When you were talking earlier about perhaps the penalties or for racist behaviours, and that you were talking about there not being sort of anything that you could readily point to, are you specifically talking about where racism has been experienced by an Aboriginal or Torres Strait Islander medical student or doctor, or are you talking about practitioners who are racist? Oh, well, I guess it could be both. Sorry. Do you mean from a clinician?
It is actually... Sorry, go.
No, you're right. I don't know if I misunderstood what you said.
No, so it is both. So both, Aboriginal and Torres Strait Islander students and clinicians, in terms of how they report and how that's managed and escalated, and then the penalties in terms of, the probability of someone being found to have practiced, or has practiced in a racist or discriminatory kind of process. The other bit is also about how do we hold clinicians up who practice in an unculturally safe manner or a discriminatory type practice. How do we penalise or create some accountability to change their ways? And again, this is where, we need to work with APRO, who is our regulatory body, to make sure that there are pathways and a process there so that we are, changing, clinicians' practices in the space.
What role, if any, does the Health Practitioners Board have in that?
Sorry, say that again.
What role, if any, does the Health Practitioners Board have in that?
Look, they have obviously an important role to, again, each board have their own code of conduct, particularly in medicine. There is a code of conduct for medical practitioners, and in that talks about cultural safety and racism. And so the board have a responsibility to make sure that they've got systems and processes to be able to, one, manage complaints and to protect those who make those complaints, but also how they deal with those clinicians who do or have been found to practice in an unculturally safe or racist manner.
Are you aware of any clinicians who have been successfully, my lawyer brain is saying the word is prosecuted, but I know that's not the right word in this context, for racism?
I I don't know personally. I've just heard from other clinicians and members of their organisations that have heard that clinicians have been brought to APRA, but I don't know what the outcome was after that.
Thank you.
Thank you, Ms Cook. Mr Smith.
Yeah, thanks, Dr. Malouf. You mentioned APRA, and a case came to me once a long time ago. I guess for a bit of context, a bit of background, one of the things that when I go to community, people speak about a lot is, the day when one of our young people goes out, becomes a doctor, and comes back and is the doctor for their community, or nurse, or health worker, or whatever. Yet the APRA frameworks around being able to provide medical care for kin and family are pretty rigid. Is something as simple as APRA not being flexible enough to work around kinship relationships and community, preventing young Aboriginal and Torres Strait Islander doctors from going back home to practice medicine?
I don't necessarily think APRA is the barrier. I think the barrier is the education space. So, as a medical educator, and again, I'm not a doctor, I'm a PhD, but I've taught in medical education for quite some time. But the curriculum doesn't promote opportunities for Aboriginal and Torres Strait Islander medical students to return back to country and to practice. And so, medical education has this ability to social engineer mindsets and understanding to kind of, stay within where they've been taught. As well as specialist medical training as well, doesn't have the flexibility for more to go back on the country to, do specialist pathways. They're often drawn back to metropolitan settings. And so there needs to be a conversation within medical colleges as well as the Australian Medical Council, who accreditates the college and medical schools, around allowing for flexibility for students and trainee doctors to be able to go back to community to practice or to train, because we know that more likely to stay in community and in practice than coming to metropolitan city and actually stay in city. Dubbo medical program in the University of Sydney, who runs the medical program in Dubbo, we've seen Indigenous graduates of that program actually stay in Dubbo because the 4-year program is in Dubbo, and so it keeps them there. But specialist training pathways don't allow that flexibility. So I think, the Australian Medical Council needs to be flexible in terms of meeting the needs of Aboriginal and Torres Strait Islander medical students and training doctors where they come from.
Cool. Thank you.
Thank you, Mr Smith. That concludes the questions that we have for you this afternoon. You also might receive some additional questions on notice from committee members. And if and when you receive those, the committee is asking that you please respond with your answers to the committee by the 19th of August. You'll be sent a copy of the transcript from your evidence today, and if when reading through it there are any errors that you find there, you will have the opportunity to request corrections to any errors that you find there. Thank you very much. That concludes today's proceedings. I thank witnesses for their attendance and broadcasting and the Secretariat for their assistance throughout the day. I declare this public hearing closed.